Afternoon, everybody. I hope everybody's staying safe and healthy at home. Welcome to Stratbase ADRi's first virtual roundtable discussion, or vRTD. My name is Paco Pangalangan. I'm the Executive Director of the of Stratbase ADRi. Usually, the Institute conducts these sort of discussions in person, in a conference room, but of course, with the circumstance, we aren't able to do that today. But just because we can't doesn't mean ideas don't need to be exchanged or that these discussions we'll be having aren't relevant. In fact, all the more are they important and relevant now that we face these new challenges. Our discussion today will revolve around the topic of the Philippine healthcare system, emergent and pressing issues, approaches, and perspectives. We've invited a few speakers to share their thoughts and ideas and hope to get some reactions from our panel of reactors and participants as well. But before we move any further, I wanted to first introduce Mr. Lindo Manhit. He's the president of Stratbase ADRi to give the opening remarks for today's event. Sir Lindo?
Paco, good afternoon to everyone, and welcome to our virtual RT, Philippine Health Care System, Emergent and Pressing Issues, Approaches, and Perspectives amid the COVID-19 crisis. We're happy to have everyone, but allow me to share a few slides to reflect my thoughts on this topic, and collectively our thoughts in Stratbase and our research team. Just this morning, my regular commentary in the Daily Inquirer, I felt that it's good to talk about the healing power of collaboration. And I wrote, the coronavirus pandemic has exposed the vulnerabilities and intricacies of governance and healthcare system in the country. Our battle against COVID-19 becomes more challenging because of the particular systemic and perennial problems pertaining to the unimproved healthcare facilities and workforce, a dependent labor force, and the lack of financial resources. But I know, as we gather this afternoon, collectively, we can find solutions with our different point of view. And I wanted to share also what we have tracked since the start of the year. This is part of our Strat-based research and intelligence. We have tracked this early in January, especially the Philippine timeline, where we took note of this virus coming from Wuhan, China, and we felt in our own tracking that the tourist arrival, possibilities of POGO workers going home to China and coming back could have created more problems than expected. But still, it took a month really for government to, that's basically by March, when we took some time for government really to put that angle of emergency to this situation. But on our part, we continue to track it. We have been in lockdown. Our lockdown, especially for those in Metro Manila, have been extended by the end of this month. And we all know that by this afternoon, we will have a new tally coming from the Department of Health by 4 p.m. But we know that what it has taught us, and the government even uses the word healing, or we heal as one, is that we need a whole of society approach. And I differ with government when they keep on saying whole of government. As a retired professor of governance for more than 2 decades, I have always spoken of governance as whole of society. And that's what we have today in this virtual RTD, representative of whole of society. And we see our own president, after so many weeks, maybe realizing the power of government might be strong, but the power of government in different levels, the local government leaders, the private sector, civil society, can be the best way to address this pandemic. That's why I'm reminded of what I wrote exactly the day after they extended their lockdown. That was April 7, so I felt like writing one for Business World, where I wrote, what we need are courageous and thinking leaders. And that's what we have in this virtual roundtable today. We will set aside ambitions and hidden agendas for the sake of the Filipino constituents. Leaders who are ready to take a stand and provide solutions in the face of global health crisis. So allow me, in behalf of Stratbase ADR Institute, to thank everyone who are participating. And I turn it back to Paco so we can proceed with our speakers from the academe, from civil society, from government, and the private sector. Thank you, Paco.
Thank you, Mr. Manhit. Before we proceed to our, that's coming from my end, I'm sorry. But before we proceed, I'd just like to set some house rules before we proceed to our speakers. We encourage everybody to make use of our Q&A feature over there at the top of your screens. As much as possible, try to mention when you do have questions, who your questions are addressed to. And please try to identify yourselves as well in your organization. We have a team that's collecting all of these questions, and we will try to address as many of them as possible when we get to the end of our program. For our speakers and reactors also, because of the interest in our event today, we have a packed program. So please also try to keep to the time allotted in the program. We'll have some internal cues over here from our team who will try to remind you when we are heading towards the end of your allotted time. That said, I'm going to go ahead and introduce our first speaker for today. Our first speaker is Dean Ronald Mendoza of the Ateneo School of Government. He was previously with the AIM. He has served as a senior economist for the UN. He has also served, and he serves now as a senior fellow for the East-West Institute in New York. He'll be here to discuss, among other things, some ideas from his upcoming special study for the Institute entitled COVID-19 Navigating Inclusive Recovery Towards the New Normal. Dean Mendoza, I turn it over to you.
Thank you, Paco. Thank you, Dido, for the kind invitation. I hope you can hear me. I'm going to try and share screen now and see. Can you all see the screen?
Yes, you can see it, Dean.
Great, okay. So I'll try to be quite brief. I understand I only have 10 minutes to share some of these ideas. And I will try to skip some of the slides since I sent my full paper in advance, so people who are interested can just refer to the full paper. So let me just begin with the framework. And I think this is the famous flattening the curve. Except my sort of critique of the discussion so far is that there's been so much focus on the health part and not so much on the economic part, which some of us believe is now the growing risk for the Philippines and perhaps for the global economy. So this is really the gist of my paper, that we should really balance the policy options and explore to what extent we can obviously protect our people from COVID-19, but at the same time, do it with as less social economic costs as possible. So that's the COVID-19 cases. There is a hypothetical peak at 1A. There is a practical absorptive capacity of the health system. What we want to do is essentially flatten it so that it doesn't overwhelm the health system. This is the basic narrative. And we are all agreed that this is the key strategy. However, what we should keep in mind is that in flattening the curve, we are actually going through a crisis relief period where we might actually be increasing social and economic costs, which also eventually have implications on social welfare. And in moving to the next phase, which is crisis recovery, presumably when we start to open up again, we want to do so in a way that is stable, inclusive, and essentially prevents us from a relapse, another explosion of the cases. And then we ask ourselves, well, if we go through recovery and eventually things stabilize, then what will the new normal look like? So part of what my paper looks at is actually hypothesizing, well, what would it mean if we wanted to build back better and come out of this crisis with increased competitiveness, better welfare for our people, and maybe a little bit of resilience against the next health shock, which is surely going to come. As we've seen SARS, MERS, and now COVID-19, this is something that we should really be prepared for. This is the curve that I mentioned. We are not talking about too much, but now there is increasing understanding that this all comes at some kind of economic cost. And what we want to do is plot a recovery from 2B to 2C, which is hypothetically that stable, inclusive, and robust recovery that we want to achieve. In my paper, I try to outline that one of probably the most effective ways to do this is to promote a health anchored recovery for the country. So basically invest in the health system, strengthen the social protection system, make sure that you know, all the weaknesses that we've seen in the past month and a half, 2 months, we try to address them as soon as we can so that the recovery is inclusive and more stable. So this is the unfortunate truth that we now need to face. 84 quarters of uninterrupted economic growth for the country has just been stopped dead on its tracks by COVID-19. And we were one of the few emerging market economies in the world with this kind of bragging rights, where we had pretty much a resilient and stable growth that has been there for the better part of the last 20 years or so. Unfortunately, what we now have is a negative growth in the first quarter of 2020, and we expect a bit of difficulties in the coming quarters and maybe the year. So NEDA estimates that essentially, this is an earlier estimate of NEDA, I won't belabor the point. They estimated actually flat GDP in 2020. So at best, we won't grow, but we won't recede either. Unfortunately, the latest news is that they needed to recalculate. And so after 2 weeks, they now released this information that actually we're expecting a deeper than expected contraction for 2020. So -2 to -4% for 2020, which is definitely quite worrying considering that economic recessions also cause deaths, also cause health problems, and also cause social welfare declines. So this is what we're seeing right now. It used to be a forecast of 6.5 to 7.5% growth, but it went down to flat growth, and now it goes further down to -2 to around -3. So what has been the budget response? Part of it is to now allow for a bigger budget deficit, but also to relax the debt to GDP ratio targets so that we will increase the debt footprint for the country. The good news is that we have some fiscal space to actually expand the debt footprint for the country, but we cannot keep on doing this forever. We need to have our economy running again so that tax revenues will be there, and so that we will have the means to actually pay for a part of this recovery. So we cannot borrow our way out of it. This is the stimulus package, and in the interest of time, I'm just going to show them very quickly here. The final point is what I really want to share some thoughts on, which is the economic recovery plan, which is not yet detailed and which we still have time to actually debate and maybe even enhance in the coming weeks. The economic recovery plan can actually be improved, I think, if we adjusted what is clearly a strong message, which is to return back to the build, build, build strategy, but to adjust it somewhat and improve it into a build back better strategy. And build back better can actually be targeted by improving education and health investments, And that, I think, is reflected in the proposal of Congressman Joey Salceda and Congresswoman Stella Kimbo. So this is my observation, that the country that can actually build back better is not only a more stable recovery, but also a much more inclusive one. And we have a lot to learn from the other countries. In the past weeks, we have been collaborating, we in Ateneo Professional Schools, which includes the law school, the business school, the medical school, and the School of Government. We have been collaborating with the embassies and consulates of different countries to try and absorb some of the lessons in COVID-19 response in other parts of the world. In Taiwan, I think you're very familiar with this. One of their main strengths going into COVID-19 is that they learned the lessons from previous health shocks, but they also have a world-beating health insurance system. With a very small copay, the expert from Taiwan told me it was only $5 per pop, and it's virtually 100% coverage for insurance. Vietnam is sort of an interesting case in that it's sort of a low-cost strategy, but underpinned by transparency and trust to the extent that citizens voluntarily share their information, or at least part of their information, with their own government. Sign up to this app that the government has created for them, and this app allows for much more effective contact tracing and also tracking of the information for their own actions. Finally, there is South Korea, which seems to be the gold standard right now. Everyone's talking about how they effectively stopped COVID-19 despite having big numbers in the beginning. And two things pop out, which I want to point out here, which is the first is their surge capability, which I believe is something we must acquire in the Philippines if we want to come out of this much stronger than when we went in. The surge capability is essentially shorthand for an ability of their health sector, public and private entities, to realign rapidly in the case of a pandemic, in the case of a crisis, so that they can work as one and essentially respond to the crisis quite effectively. The other part, which they are known for, is the mass testing. And unfortunately, different people have different understandings of what you mean by mass in mass testing. But in the case of South Korea, they have pretty much made it available to such a degree that if people want to, as I understand it from the explanation of the expert, if people want to get tested, they can actually get tested, and it might be covered by their insurance. But definitely, if they show the symptoms, they are encouraged and basically they get tested to get that information. So here are the main things which I gather from a health sector anchored recovery. These are very initial. Obviously, we need to adapt them to our circumstances. Number one is the adoption of technology for rapid testing, apps for tracking, information sharing, but also this long talked about telemedicine, which we already, in fairness to our health system, we have already been piloting this and adapting it. We just need to accelerate a bit this process. It allows us to actually offer in a more cost-effective way health services, but at the same time, as you can probably tell from telemedicine, it also helps protect our frontliners so that they can offer some of these services without even physically being near the people that they're trying to help. The other one is, of course, trust for compliance with quarantine and willingness to share information. This is something that is not necessarily unique to the health system, and we need to build in the collaboration with the local government units and other parts of the government. And I believe this is part of the soft infrastructure that we need in order to respond to crises much more effectively. In the absence of trust, if government does not trust that the people will follow rules, or if the people don't trust what the government is doing because they don't understand the data, the information, they don't think the curve is being being flattened, they distrust pronouncements, then this is not sort of a regime that is going to necessarily be effective against the crisis. And the final point is to transform a brick and mortar health system into something that is actually much more agile, much more cost effective, and begins to bring us into essentially a new system that is much more inclusive and much more agile in a crisis situation. Why focus on the health sector? I'm just going to go through this very quickly. Consistent with immediate crisis response. So if we're going to have a recovery process and we're going to allocate scarce resources, we won't have a stable recovery if we do not give the signal that the health sector has recovered its absorptive capabilities, its strength, which right now it seems, according to different discussions, many entities in the health sector are actually feeling great financial pressure. The economic recovery period should be underpinned by a test, trace, and track strategy. If obviously you need the health sector in the front line of this. Third, and I agree with Professor Dindo Manhit here, he has a very nice article that he wrote a few weeks back. The health sector is going to be critical in the psychology of recovery. Recovery is not just about opening up our economy, allowing our people, our investors to get out there. If they fear that there's going to be a W-shaped recovery, if they fear that there's going to be a relapse, if they don't trust our systems, they will not invest. They will wait and see. They will not even consume and rather save because they think maybe a health shock is waiting for them in December when one person in their family might get sick. So instead of being basically bullish about recovery, many entities, people, consumers, investors might actually hold back. So this kind of psychology is now being observed in many countries that have opened up but don't see the kind of economic growth and economic activity that they expected. Nothing like before. And finally, the healthcare system in the Philippines offers strong investment and growth opportunities. In fact, this was identified as one of the sunrise industries for the country and medical tourism that many people were actually expecting to help bring back some of our health personnel that are working as doctors and nurses abroad. So this was the ambition in terms of strengthening the health sector. Let me end with this slide, and I hope I have kept as much as possible to the time. I believe a health-anchored recovery is going to be in our benefit because a more inclusive and robust healthcare and social protection system actually helps strengthen social cohesion and trust in the state. Because the first thing that will make you not trust the situation is when you are excluded, when you don't think you're going to be covered by the safety net. So making that strong is going to work in our favor. Strong trust in the state can then feed back into a more effective crisis response. And in an article that I just wrote and released this morning in The Diplomat, I tried to argue that one way to actually think about this crisis is that if there is so little trust, then you will, and so little sophistication in our institutions and health systems, so little investment in these systems, so little inclusion, what we will end up with is actually less options and a tendency to actually revert to very draconian measures like lockdowns. But if you have strong trust, agile systems, sophisticated institutions, and much more inclusive social protection and health systems, then we don't need to revert to draconian measures. We don't need to revert to an axe in terms of policies. We can actually revert to a scalpel, something much more specific, something much more sophisticated, and something that allows us to not have such stark trade-offs so that we can save lives, we can actually protect our people without having to pay such a high price in terms of socioeconomic disruption. Thank you very much for the time to share these ideas.
Thank you, Dean Ron. That was a very insightful talk, and yes, you were able to keep to the time, so thank you for that. At this point, I just wanted to note, thank you for all being here. We have at this point hitting 150 participants. So we're very happy that there's a lot of interest in our talk today. And I think, again, it's a very, what do you call this, a complex issue we're facing. So Dean Ron, did discuss some of the economic and governance issues. And he did finish on a nice note there that segues into our next speaker about draconian measures. Since we are up next, we have Dr. Sherwin Ona, who is the chairperson of the Department of Political Science from DLSU. He also serves as a senior researcher at the Jesse Regredo Institute of Governance. Dr. Ona, his interests are in the areas of human security and non-traditional threats, open government, cybersecurity policies, and disaster informatics. Just so happens as well that Dr. Ona is authoring or in the process of writing a special study for the Institute entitled COVID-19 and Security Governance, an initial examination of the Philippine experience and its possible implications for policy development. So to discuss some of the ideas again and the comments that Dr. Ona has, let me turn it over to him right now. Dr. Ona, please.
Hello, Paco. Hello.
Hello. Hello. Yes, we can hear you.
It's thank you very much.
There's a bit of an echo.
Is that so?
Okay.
Can you hear me now? Better?
It's good now. It's good now.
It's good. All right. All right.
Yes.
That's good. Anyway, of course, thank you very much for inviting me, Sir Dindo. It's good to see you. How are you, sir? And of course, thank you very much, Dean Ron, for that very insightful presentation. I hope to add to your presentation as well. We have similar viewpoints, but without further ado, allow me to proceed to my presentation entitled Security Governance and COVID-19 Policy Implications for the Philippines. My talk will basically deal with securitization and how a highly securitized approach is not sustainable in the long run, and there's a need for the Philippines to really desecuritize its approach. Lesser draconian measures, as Dean Ron mentioned a while ago. But this is the outline of my discussion. Basically discuss the securitization, desecuritization process and look at the Philippine experience and point to some of the possible policy interventions that can be done. Now, security studies have been around for a few decades. Since the end of World War II, we've seen the rise of security studies, and of course during the 1990s, the theory of securitization. And securitization is more or less connected to traditional threats, the threat of conventional wars. When you read about literature on this topic, you will see the prominence of the words or the phrases NATO, Warsaw Pact, the prominence of security, mainly traditional threats. But since the 1990s, there's been a shift towards non-traditional threats, meaning threats that, examples of these are threats regarding terrorism, cybersecurity, climate change, and of course, pandemics. There are more movement towards the human security side, so to speak. And of course, my argument here is securitization initially is fine, but it's unsustainable. And so what is securitization? So it's about a securitizing actor, a political actor that frames a problem as an existential threat. And this existential threat is equated to a national security threat. And this also means that an audience agrees to this. No? In this case, citizens of a society or a country agrees to this framing through speech acts and linguistic methods. Okay, and this framing allows the actor, the political actor, to use extraordinary measures to quell the threat. Now, my argument is that yes, initially that can work, but given limited resources, given a developing country context, this is certainly unsustainable. And for this, the idea of the securitization is very much appropriate. This simply means that we need to pull the highly securitized approach to a more desecuritized approach, pulling it towards the normal level of the politics, normal level of the political sphere, so to speak. And we need to manage this. That's why the topic or the concept of security governance is very relevant here. So we've seen securitization of health. Dean Mendoza mentioned SARS and Ebola and Zika. We've been seeing securitization of global health since the SARS outbreak of 2003. Okay, and the World Health Organization has a big role in this ongoing securitization. In fact, they're being widely criticized, especially in Ebola, for their slow response. That's why there is really an interest towards securitization of international global health. Now, what is wrong with securitization or highly securitized approach? Well, according to literature, too much securitization often leads to a garrison mentality, purely taking a national defense view. This means that, for instance, a pandemic or a virus outbreak is equated to an invasion, which is, it's a very nationalist approach towards dealing with such a threat. And usually, in this type of scenario, powerful countries take precedence. In Ebola, that's why the World Health Organization was widely criticized, because they were perceived as prioritizing Western countries first before African or developed countries, or least developed countries. And the highly securitized approach usually has a tendency of diverting resources from civilian institutions to military programs. All right? And usually securitization ignores the human and physiological aspect of a threat, of a pandemic, and merely focus on the risks and dangers. And last but not the least, it usually leads to abuse of emergency powers. And the validity of these emergency powers become indefinite. Right? Now, there are ways on how to desecuritize. There are different authors who have proposed certain ways, but they lump this all to the idea of managing desecuritization. And one way is merely taking an institutional approach, having what Dean Mendoza termed agile institutions, responsive policies. There are also what San Giovanni mentioned as formal and informal regimes. I'll go to this later. And of course, there are some acts to desecuritize. So what's the implication now? And we can see really the securitization of COVID. Okay, if you want examples of highly securitized approach, examples of Israel and Thailand are very prominent. What do you mean by highly securitized approach? Usually, this is characterized by total lockdowns, ban on transportation, usually reliance on its military or security forces. So it's characterized by strong militarism. Okay, you will idea of whole of society approach. Okay, they use this term, but usually with this whole of society approach, governments in a highly securitized environment ask for special powers. They ask for emergency powers. And this is true in the case of Israel and Thailand, wherein in the case of Israel, it was really a highly militarized approach to the point that Mossad was even given the responsibility of coordinating all the COVID-19 efforts of the government. Can you just imagine Israeli intelligence coordinating all of these health-related efforts? Thailand, of course, we know for a fact that it's being ruled by a former general. Its prime minister is a former general. And it shows its reliance on its military and security forces. Citizens, in this case, are generally receptive to the idea because of the uncertainties brought by the pandemic. But of course, there is the other side of the coin. Critics are concerned about potential abuse. We can see that also here in the Philippines. Well, there are countries that we can, or I termed as moderately securitized. No? Dean Ron points to Taiwan and South Korea, the exceptional countries. These countries avoided total lockdowns, by the way. Okay, and as Dean Ron pointed out, they simply learned from their mistakes. Taiwan learned from SARS. South Korea learned from MERS-CoV. Okay, and if you read through the speeches of their political leaders, the president or the prime minister, yes, there is a call towards full of society approach, but they don't talk of wars. They don't liken COVID-19 pandemic to an invasion or to a war. Unlike in highly securitized societies or environments like Thailand and Israel, the point of mobilization is that it has a strong militaristic tone. Threat against, it's very similar to a war mobilization. Okay, of course, in the case of Taiwan and South Korea, you can see that there is a high degree of innovation, and they're very particular about trust. Okay, as Dean Ron pointed out. And you will see that there are frequent official pronouncements, and these official pronouncements, you can watch it online or you can read it. Okay, so they're very open, they're very transparent. Now, allow me to go to the Philippines, which of course I regard as a highly securitized, which has a highly securitized approach to COVID-19. Well, if you remember, we have been in a national state of emergency since 2016. Okay, but through Presidential Proclamation 55, but the rationale for this is lawless violence. But now the framing of COVID-19 is really securitized. The president referred to it in one or more than one instance as an invisible enemy, and it requires a whole of government approach. And as you can see, defense and law enforcement officials are sharing the limelight with our health officials. But you know, initially, it was not like that. By March 8th, the president, through Presidential Proclamation 922, used the Public Health Emergency Act. It's a surveillance, it's a decisions act to mobilize whole of government. But when the World Health Organization declared it as a global pandemic, then everything changed. By March 16, if you watch the announcement on TV, you'll be surprised, right? The president is flanked by generals instead of doctors, right? It's very reminiscent of martial law or the EDSA revolution times. And by March 16, of course, the government was now imposing total lockdown of the whole Luzon and imposing curfews left and right. And you can see, of course, military units being deployed in our cities. And of course, we have the Bayanihan Act, which gives the president emergency powers. And these are really draconian measures. Now, the question here is, how do we move from a highly securitized approach to a desecuritized approach? Well, again, the point here is we need to manage it. All right. We now address legitimate concerns. I would like to add to the health aspect that Dean Ron mentioned. Yes, that we need to ramp up testing. We need to ramp up contact tracing, all the works, and possibly stop or prevent a second wave resurgence of the virus. There is Dean Ron mentioned the economic aspect. We need to restart the economy, but very prudent at that. In the United States, we're talking about phased reopening. Of course, we need to guarantee to ensure the efficacy of social safety nets. We need to emphasize this. Social amelioration for peace, the ACAP program of DOLE. We need to make sure that these resources go to the intended recipients. All right. And lastly, we still have an internal security problem. So our security forces, our government, is trying to balance that. Now, the next way of managing it is through formal and informal regimes. Of course, we need a law. Bayanihan Act was that law, but this time it's very important to have congressional oversight. We need to emphasize this again. This is not the martial law declaration of 2017 or 2016 national emergency. We are really mobilizing a lot of national resources for this, and it needs oversight. Of course, we need to emphasize good governance, importance of transparency, openness, and promoting trust. And of course, last but not the least, for this suggestion is having a stronger national and local coordination. And last but not the least, for managing will be policies and programs. Haven't really looked at our national security policies, and you'll be surprised if you do, because there is very little mention of pandemics. In the national security policy of 2017, there was only one word, and that word is pandemics. One word that mentioned something about health. It mentioned health, but the mention of pandemic only once. When you look at the national security strategy, it's like 1/4 of a page mention of pandemics. Okay? And if you look at the modernization plans of our armed forces and our police, there is literally very little mention of health pandemics. And down to my last slide, I think. These are my suggestions. Non-traditional threats now should take prominence in our national security planning. We did not identify medical supplies and equipment as a strategic industry. In our national security strategy, we identified like a dozen strategic industries, but we did not identify medical. Okay, so there is a need for us to put that there. Okay, there was a mention in Dean Ron's presentation about agile organizations, and I need to stress that here. We have enough laws. Okay, if you look at our disaster risk reduction management law and our disease surveillance law, that could have been enough to stem the tide of this pandemic. Okay, there are proposals, of course, to expand RITM and create the Philippine Center for Disease Control. Is that time already? I'm sorry. Can I have 2 more minutes? And of course, I'm an advocate for digital transformation. So this is an opportune time for us to take digital transformation. And last but not the least, forge international cooperation. When the vaccine is available, we cannot allow big countries to really dominate the vaccine supply. So we need to harness our regional partnerships in ASEAN, or even our role in World Health Organization to really give meaningful participation to this. And this is my last slide. All right. Thank you, and sorry for that.
Thank you, Dr. Ona. Understandably, 10 minutes is a bit of a...
I told you.
Yes, you did indeed. I think I'll just jump into our next speaker to save some time. Don't worry, Dr. Ona, it was a very insightful talk you gave.
Thank you
for that. Next up, we have Dr. Eduardo Banzon. We know Dr. Banzon as a principal health specialist with the Asian Development Bank. But I think for most of us anyway, we also know him as the former president and CEO of the Philippine Health Insurance Corporation. Dr. Banzon is a champion of universal healthcare and has long provided technical support to countries all across the world. May I please next have Dr. Banzon. Are you here, Dr. Banzon, to talk about
I'm here.
testing and
here.
tracing?
Yep.
Yes.
Okay. So,
Dr. Banzon, the floor is yours.
okay, I'll share the screen now. So, what am I supposed to? Sorry, this technology.
It's all right.
I'll try to share.
We're all adjusting to this new normal.
Yeah. Can you see a PowerPoint?
We can see it.
It looks like a coronavirus.
Yes.
Okay. So let's talk about UHC. And when we talk about the health sector, let's not forget the Philippines passed a universal healthcare law last year with that basically was addressing a lot of the problems that we love to talk about the health sector, but really lots of solutions are just talk about. So I see this UHC law as moving beyond talk and really trying to give very specific directions. And as we move forward in this post-lockdown world, in this world of COVID, let's not forget this law. It talks about all people covered. That means, but of course, this means more people has to pay into the premiums than the others. It talks about the clear delineation of population and personal health services. It talks about investing in primary care, talks about how to rationalize, in a sense, a highly devolved delivery of health services by government at the provincial and city level, harnessing the private sector, including very powerful provisions on price control, and getting the private sector to contribute even if they don't want to in cases like this, public health crisis. Talks about financial protection as an explicit target of the government, in a sense, whole of government and whole society approach. Quite unfortunately, this law was only passed last year, and the country, in a sense, the Philippines did not have enough time to implement a lot of these wonderful provisions in order to address something which we call COVID. It is an invisible enemy. You need to really attack this like in the way you attack a lot of enemies, because this is quite a very difficult. And of course, this COVID is not just something that has no cure. It also affects the symptomatics. It's like a perfect storm if we talk about viruses. So how do we address viruses? Well, we can go back to way back in time, if you think about it. So in a sense, the community quarantine approach that we're talking about was the same way that they tried to, we address bubonic plague. Of course, I wasn't born yet. The picture in the middle essentially is army people being used somewhere in Europe so that people in the houses stay in the houses so that whatever infection, I'm trying to remember whether there was anthrax or the plague, do not spread. Because the way you address a virus which you do not have a vaccine, which do not have a treatment, is to make sure that people who are infected do not spread it. Okay? So that means you isolate, essentially. And when you see a rapid spread, that means there's an exponential spread, obviously good public health practice means you try to also actively quarantine. And I think that's what happened in the Philippines and in a number of countries where the exponential growth was happening. Luckily for us in Asia and the Pacific, there were a number of countries which were able to stop this before it happened. Okay, the Philippines unfortunately had increasing number of cases exponential by the time March came in. We now have more than 2 months of quarantine. And so the question is, where shall we go? Next slide, please. Sorry, I'm the one controlling the slide. My apologies. So we in the Asia Development Bank has tried to look into this. So a recent work that we did look into certain scenarios where we compared expanded general quarantine, community quarantine, general community quarantine. And when basically we move out of that into something which we call sustainable social distancing, I think the Department of what call it minimum health standards. We're assuming that in a sense, we're just describing Sweden here when you talk SSD. But then what other things you need to do in order for you to achieve the same level of, how do we call this, prevention of the virus that the community quarantine or general quarantine can give you. So if you talk about snipers or scalpels, basically that means you should be in the position to detect those who are ill and prevent them from infecting others, which is the whole logic of ECQ and GCQ. Okay, let's never forget the health value of what a quarantine is doing. Okay, sometimes people forget that. Okay, so in the sense when we try to look into that and we start to do both epidemiological and economic, and I don't want to explain how the calculations are done. I have 10 minutes, well, probably 6 minutes left. We basically showed that investment in tracing and testing and isolation would basically approximate the value of isolation, the value of prevention of the virus that ECQ and GCQ can give you. Of course, let's not forget SSD or social distancing. It should always be part of the story. So what we have seen is that when we look at the different scenarios, a tracing level, a testing level of about 50,000 tests per day, probably 50 to 75,000 tests per day, and the numbers are changing, but at 50,000, we could basically detect 50%, at least 50% of all those with the infection. The moment we get that level, we'll be able to prevent, hopefully prevent. And if you see the curve to the right most, okay, so that means instead of having a second peak, okay, we may be able to sort of control it and shift the infection, the epidemic curve into sort of a slow burn. Okay, so that's basically what and so the message of the study that we did basically said that, aggressive tracing, testing, and isolation, when we look at it from an investment perspective, provides you the largest gain in terms of benefit cost ratio, and really there is value in massive investment in tracing, testing, and isolation capacity. So what's the new normal that we would expect in the world of UHC? Well, sustainable social distancing will be part of life in the health sector. I don't have an answer right now on how that's going to be done, but I can imagine if we look at the pictures in front of you, vaccination, where before you get vaccinated with any health worker, now you're going to have the health worker basically wearing PPEs. Try to imagine how you'll go to your dentist and try to get dental care now in the world of sustainable social distancing and PPE. Same thing when you try to get maternity care. Healthcare, that's why it's a wonderful field, and I'm proud to be a doctor and a healthcare worker because it has a very nice word, care. You have to have a caring personality, or in order to get into this profession. And care means touching, care means being close, care means being and this virus, this pandemic, basically is going to make it so difficult for a lot of my colleagues in the care profession. But this is something we have to do. So this is something. So this will need not just PPEs. This will need architectural design on how we will design the hospitals. This would need a lot of creativity. People love to raise the word telemed as if it's a magic word, and it's been around. I always ask, how come if it's so good, it has not become the norm in the Philippines? How come it's not been accepted as regular medical practice in the Philippines? Probably this pandemic gives us an opportunity not just to make it the norm, that means a lot of the legislation and the financing mechanism needs to be made compatible to telehealth and telemed, but of course not just in the Philippines, but also in other countries. Same thing, we start talking about prescription, the whole part of medicine. Testing. Look, right test at the right time. Okay, sorry, I think I need to hide this. So let's, everybody talks about antibody tests as if it's the magic bullet. It's not, okay? And we also talk about PCR, which of course technically essentially is nucleic acid test, as a sort of, it's the solution. It's the gold standard. Because what are we trying to do when we talk about testing? We're trying to detect somebody who could infect somebody else. Okay, let's be clear about that. You're not trying to determine here who has immunity, which is of course still debatable because the whole studies there are still not yet finished. You're really trying to detect who has the infection because you want to make sure he doesn't infect somebody else. You want to, in a sense, approximate what quarantine is providing us. So we know what the gold standard is. That's nucleic acid test, PCR. The innovations that are happening globally have been tremendous. We have seen PCR tests now, rapid PCR tests. The costs have gone down. I soon expect it to be lower than 2,000 pesos a test. When all of this started, probably was about 8 because of the volume and all should be going down. The Philippines has targeted 30,000 tests a day, could go to 50, hopefully 75, could be more. Then you need to supplement it. Okay, in a sense, there are 3 ways, what we call antigen tests. So if you're familiar with the virus, these are the protein that surrounds the virus. So 2 antigen tests, 1 each in the US and Japan that I'm aware of, has been approved. They have a problem with false negative, but their value is to detect antigen proteins, which basically is a diagnosis of ongoing infections. Antibody tests are at best complementary. And really, if you want this, then go for the best ones. Using antibody tests and then going for convenience and poor accuracy is as lousy as public health practices you can have. So if you're willing to accept the trade-off between what it can do, basically might as well use the best antibody test out there. ELISA test is basically the approach that is best when you start talking about detecting antibodies. But I'll just go to the next slide. Sorry. Oops. So where's the Philippines with regard with testing? Not as bad as we want to. We're ahead already of Pakistan, India, Bangladesh, and Indonesia. Our measure is something called tests per million. Okay. Korea did well, and they did their tests at the right time. And so they have been able to suppress the virus. So they're not testing as much as they should be doing. So it's not correct to say that they're doing on demand. They've always been doing it based on the risk base, based on symptoms, based on good protocol. Singapore, because they have the recent outbreak that happened in the dormitories of foreign nationals, workers, basically have, of course, responded by doing as massive a testing that they can do of everybody who is a potential contact of those that may have an infection. Japan is one country that has not really scaled up testing. And Vietnam, if you look at the numbers on a per test basis, the Philippines is actually doing well, good enough catch up. Should be doing much better, because if we look at the countries in Europe and of course in the US and Australia and New Zealand, that their testing capacity has really scaled up. But let's not forget, if you look at cases per million, sorry, and then we'll go back. The cases per million, as reported here, of course, is much higher in Europe. Could be because of the testing, could be because the infection, because in a sense, these countries basically were able to do the quarantine measures a bit late compared to the other Asian countries. But after you've done your testing, then you need to do your contact tracing. And I'd like to show this slide because, again, people say contact tracing is so good that Smart and Globe or any telco can solve it. It's more than that. Okay, contact tracing basically involves people, an army of people. The slides on top is the Singapore approach, where they actually utilize army, their soldiers to help out in doing contact tracing. So it's not something that will be solved by technology alone. It needs lots of foot soldiers on the ground, because what is contact tracing? You try to determine who could have been potentially exposed to somebody who's infectious. So you need this. You need local governments, people, so the Quezon City contact tracers, and really DOH provided the guidance on how to do it. So essentially, you need lots and lots of people to help out in contact tracing. Technology would help out, but let's avoid from thinking that it's the only solution. Finally, and this is where the Philippines is, in a sense, doing interesting work, isolation. We see the same approach that's happening right now all over Asia. After you have contact trace, after you've tested and determined who has the illness, then you need to isolate them. In Asia, where we have a lot of highly urbanized, highly dense cities, this is a challenge. And so the solution is something that's quite common across countries. So you renovate facilities to make up temporary isolation centers. It's not just your hospitals. So it could be on top. In India, they converted trains. You could use hotels. Everybody knows about the stadiums that's being converted. You could use empty spaces. And so it's something, of course, that has to be done, not just in Manila, but also all over the country. My understanding is there's guidance right now on something called Ligtas COVID. I think, and just like probably a lot of the other guidance that's been coming out from the national government, this guidance should be pushed hard and make sure that it gets implemented. And as we talk about UHC, all of government, all of society should not just be the Department of Health, should involve the different government departments should involve the private sector, where basically the perspective is to solve the problem and not talk how good you are because you found another problem or something bad that was done by government. Thanks a lot. Paco? I'm done.
Thank you, Dr. Banzon.
I think 10 minutes, right?
Yeah, you did good time. Thank you. Thank you. It's always nice to talk to you and hear about how things should be or could be or how they can be. It's always inspiring. At this point, I just like to thank all of our speakers, Dean Mendoza, Dr. Ona, and Dr. Banzon. We've covered a lot of topics so far. We've had economic perspective, political, security perspective, along as including an international global perspective and a health systems perspective. But of course, no roundtable discussion would be complete without some reactions from our panelists. But to make this this segment more stakeholder oriented, I'll turn over the moderation of this segment to my colleague Orlando Oxales, who's the convener of our partner for this project, for this event, CitizenWatch. Mr. Oxales, please take it away.
Hi, good afternoon, everybody. We have a very equally distinguished panel of reactors this afternoon. I'd like to welcome all of them. First off, on the deck, please welcome the Special Assistant to the Secretary of Health for Universal Health Care. Please welcome Dr. Beverly Ho.
Hi, good afternoon, everyone. Thank you for the opportunity to join today's roundtable discussion. From my end, I would just like to react on how what has happened during the COVID-19 response has become an opening for us to fast track several of the UHC reforms. No? So what are these? First of all, you'd see public-private cooperation heightened during this period. It seems like the so-called trust barrier that has long been questioned has really opened up to a lot of support from the private sector. And in fact, the support from the Task Force T3 is something that we are appreciative of very much now. Second is on information technology. Some of the speakers mentioned how this is actually a time for us to ramp up work on e-health, or not just electronic records, but the fact that people have been looking at data drops of the DOH, etc., is a signal that people are really hungry for quality information. And that goes without saying that quality information starts at the source, right? And in the past, we have been having difficulty along with PhilHealth to push for electronic submission of data, for example. And in a span of maybe 2 months, we have been able to ask at least 100% of health facilities within the NCR to submit data every day, no? Be it despite that it's aggregate data, it's still data that they're submitting electronically every day. And we're hoping that in the next few weeks, we will be able to capitalize on this and get more and more of the facilities and frontliners to submit electronic data. And we're also moving towards not just aggregate data, but line list or patient level data. Related to the e-health or IT support, the DOH has also issued out a first issuance on telemedicine with the National Privacy Commission. And for the longest time, we have had so many discussions with lawyers, e-health experts on liability, etc. But with the requirements of the times, all of these sort of like were put in the back burner, and the needs or the objectives were actually prioritized. Um, and then I would also like to say that in terms of health promotion, we have long wanted, or many have always been saying, oh, we should actually make Filipinos' health literacy higher or better, right? Because that will mean better health-seeking behavior and eventually result to a lot of savings for the government. And what we've seen now is that because of the nature of COVID, the basic health hygiene requirements are really now being put into the consciousness of young people or old people alike. More importantly, this has allowed the DOH to really partner with other government agencies in terms of pushing forward policies that are health enhancing towards creating a built environment or a built architecture that is promoting good health. For example, in the pipeline, we have issuance with the Philippine Sports Commission on promoting active lifestyle or health enhancing physical activities during the quarantine period. And more long term would be a joint issuance with DOTR, DWH, on making sure, and DILG, on allowing more bike lanes, for example. So getting people to be mobile, but not through typical congested public utility or mass transport vehicles. So all of these are just now cropping up because we don't actually have to knock on their doors to say, come on, let's do this. But the consciousness around the preventive aspect of COVID is allowing us so much opportunity to capitalize on building a health promoting environment in the Philippines. And I guess lastly, we're also seeing that the COVID-19 response has allowed us to, in a way, rethink how do we actually solve the health human resource issues that we're actually facing now. No? We have a surplus of nurses, but for all the other healthcare cadres, especially medical technologists, for example, and skilled medical technologists at that, we're seeing that it's very difficult to build new laboratories. Doc Dodo would be able to attest to that. A lot of people would want to donate PCRs, would donate test kits, would want to build labs. But apparently, again, the main bottleneck would be people, right? So it raises a lot of questions around what is really our strategy moving forward. And if we keep on dismissing the issue that probably we need to fix some part of the education part or the compensation or the job market part of the health human resource supply chain, then we will continue to not address this big issue, which is a critical building block of any healthcare system. So I guess I'd like to end this reaction by saying that as a young person who has been working on UHC for the last 10 years and suddenly thrust into a pandemic type of response work, this is very new to me, but I am also grateful in a way that this happened because it catalyzed a lot of things that before a lot of people thought that it was impossible for UHC to happen. And so from our end, it is about ensuring that we don't squander this opportunity to get these initiatives launched fast and get people to adopt it really as the new normal of the healthcare system. That would be all. Thank you.
Thank you very much, Dr. Ho. Really happy to have you here because CitizenWatch, as an advocacy, we were a very strong advocate of the universal health care. At the same time, we were also supporting the passage of the National Integrated Cancer Control Act. Thank you very much for that reaction. Next, we are again honored to have the Associate Professor of the UP Manila College of Public Health to give a reaction. Please welcome Dr. Sharon Villanueva. Dr. Villanueva?
Good afternoon. I would like to first thank the organizers, especially Dindo, for inviting me to be a reactor to this webinar. And this will be a quick reaction. Since the COVID-19 started in China in December 2019, we were sort of had the assurance that we will overcome this and this will not reach our country. Nobody expected that this would escalate into a pandemic, and now there have been many issues or concerns that have cropped up because of this pandemic. And the three speakers this afternoon had the talks were very enlightening. I have learned a lot, and they have sort of enhanced my knowledge or increased my knowledge, especially that of with regard to public health concerns or issues. So as Dr. Ona mentioned a while ago, there was really no mention of the pandemic in the national security strategy. That's why I think we were sort of overwhelmed when cases and even mortality started to increase. So I think this is an eye-opener, not only to the government, but to all the people, that really we have to be prepared in times of public health emergencies like COVID-19. And I guess people are starting to really learn from what we have experienced and are experiencing right now in terms of responding to COVID-19. And then another thing that interested me was the one mentioned by Dr. Mendoza, by Dean Mendoza, which is that of, and also Dindo, that of setting aside personal motives and prioritizing for common good. This is what we are seeing right now with what is happening. I think the true spirit of bayanihan has emerged, and we have seen public-private partnership. We have seen even those people from the grassroots giving what they have or contributing what they can, despite their lack of resources. And even the millionaires or the rich people, they have exerted all means in order to help our government in combating this invisible enemy that we are fighting right now. And then another thing that I have that has also struck me during this webinar or the talk of Dr. Mendoza and Dr. Garcia was that Dr. Mendoza and Dr. Ona was that of the trust. This is very important right now. We have seen or we have heard many issues, trust issues with what is happening right now. But I think the government trusting the people and the people trusting the government are very important. So I think this is where the risk communication comes in. So as a public health person, I would inject the issue of risk communication. This is especially true at times that we are facing this COVID-19 pandemic. So public health emergencies like this time, at this time, risk communication would be very important. This would entail involving all the stakeholders, even from the government until the grassroots, making them understand what is happening and involving them in the decision making as well. And I guess with this, it will really make combating this COVID-19 issue very easy if all the people would really join hands and really trust each other and collaborate as well, because we all know that there is no single entity or single person or even a single agency that can really solve all these gargantuan of problems that we are facing right now without really trusting and collaborating. So I guess what is happening, the very good thing that is happening right now with our country is that people are collaborating, people are starting to trust each other, or strengthening the trust of each other. And also with what Dr. Ho mentioned earlier regarding the enhancing the public health education or health promotion, I guess another good thing that has happened with this COVID-19 pandemic is even the ordinary people or the bystanders were very informed of what COVID-19 is, and the behaviors changed, like even as simple as hand washing or social distancing, we have already inculcated in them. But I guess the problem would be once we have lifted or we have really transitioned into the GCQ, which will happen by tomorrow, except for some places here in the Philippines. I guess we really have to ensure the strict implementation of all the preventive and control strategies that we have started implementing since we have faced this COVID-19 pandemic. And also, I guess we must not be complacent, even if some people are saying that we have already started to flatten the curve, but we should not be complacent, but still really abide with the preventive and control strategies. And also, while we are waiting for the development of an effective vaccine and also an effective treatment, we must also really try to capacitate people. And I guess from a public health, from a person from the public health, we are involved in capacitating people. So as public health individuals, we are involved in, we have been consulted by some agencies or by some institutions in terms of, like in our department, we have been involved in microbiological testing, and we have research proposals that have been submitted with regards to COVID-19. And we are also involved in the DOH and WHO surveillance of COVID-19. So I guess the involvement also of the academe in all these in this crisis is very important, because again, the key here is collaboration. So we must not leave this problem to be solved by only one agency or our government, but other people may also help or contribute their knowledge and skills towards the solution of these public health menace that we still do not have enough knowledge of. So thank you very much.
Thank you very much, Sharon. And yes, very important is really collaboration, trust, and so that we can actually tap the resources, talent, and creativity and innovation of the private sector. Next is a very important, actually, our next reactor is one of the partners of CitizenWatch in its health advocacies. He's the vice chairperson of the House Committee on Health, the representative of Anakalusugan party list, the only health advocate party list in Congress, and the convener of, I'm sure you've heard about this very active project, Actus One PH project. Please welcome the Honorable Representative Mike Defensor.
Thank you so much, Orly, and good afternoon to everyone. I'd like to first thank Dean Ron, Dean Ona, and of course President Banson of PhilHealth, former President Banson. Well, I'd like to base my reaction on one basic campaign that we should be having to date, which is the mass testing. I think Dodo Banson emphasized this point so much. In terms of the economy, in terms of health, I think mass testing is very, very critical in order for us to be able to combat this disease and also to recover from the economic effects of the coronavirus. Um, Earlier, it was mentioned that the economic stimulus should be built back better, and I agree with it. But I would like to clarify that, well, because I'm coming from a perspective of one, being actively involved in the private sector in terms of combating the virus, and secondly, also on the policy making side. We have been looking into several aspects of what is happening in our country today in terms of the economy, in terms of health, in terms of security. On the question of on the proposal of Dean Ron of the Build Back Better, I agree with it. My only point in that is, you know, in the case of education, we might want to look into it a little further because last year there was an allocation of 50,000 classrooms and they were only able to build 20 classrooms. So what I'm saying is that you have the budget. Yes, there is already, it's there already, and it's a constitutional mandate that education would have the biggest allocation. But in terms of focus, I think it should be health and agriculture. We should be continuously building. That has been a proven formula. You showed, there was a graph earlier about economic development, and the Build, Build, Build program has always been proven to be a good formula in order to push the economy and to have economic activities all over. We all know that construction is about 3 to 5 multiplier effect. It gives people jobs. There are many allied industries with construction, and so I would support that point. In terms of the effect, the actual effect on our workers, on the daily wage and informal workers, the coronavirus has affected 30 million people. OFW, 250,000 workers. For the small and medium enterprises, 6 million establishments with about 1 million establishments with about 6 million workers. For the non-essential services, 17 million workers. And critical industries, 5.4 workers. And so, what is the formula for this? They are looking into different subsidies. We're doing that now, the TUPAD. But we have to look into other economic stimulus program in terms of financing, in terms of loans that don't need collateral, loans that we can provide with no interest in order to push the economy. Of course, the basic question would still be, do we have the cash for that? It was stated earlier that the effect is about 2 trillion pesos. We estimated earlier before at about 1 trillion pesos. So I would suggest that 2 trillion would be the basis for the losses that we would look into. But really the problem is when they started opening up the ECQ and the GCQ, again on the policy side, the IATF allowed several industries, but yet again, there were so many constraints. For example, if there is a construction, you have to register it with the Department of Public Works. If there is a construction as regards airport and ports, you have to register it with the Department of Transportation. So that process, cumbersome process, by the time that you lift the ECQ or the GCQ, is the only time that you can really proceed with construction. I would rather that they open up these industries, have the establishments register with the LGUs, and control the movement of those people in charge in these particular industries, or those industries that are allowed. Now I would go back to, I'll go to the question of health. Earlier there was a question about contact tracing. How come we are not so good with that problem? I think initially the problem with the Department of Health is the Public Health Emergency Act. This allows the release of the names of the persons unless ordered by the court. And this is very clear in the law. So, well, the IBP mentioned it already that, you know, and I think the association of several journalists came out and saying that, no, this should be allowed. But really, there is a law on that we should amend. Why? Because the contemplation of the law before was, you know, the question of AIDS, the question of some diseases that may be of private in nature. But in this particular case where you have a pandemic, where people also want to know who these people are, and, you know, this particular patients infected would like to inform others where they went, what happened, who they had contact with. These are things that we need in terms of battling COVID-19. Gusto ko lang sabihin that COVID-19 is really a new situation for all of us. And there is no really expertise on what to do in terms of health security and all that. Initially, the World Health Organization was saying, do not go into travel ban. After about 2 weeks, if I'm not mistaken, they said travel ban. They said before that, you know, you don't need to wear a mask. And that later on, it was again changed into, yes, everyone should be wearing a mask. So what I'm saying here is that we tried as government to address it as much we can given the information we have. So when we went into ECQ and GCQ, it was not really to prevent the disease, to stop the disease or to cure the disease. It was to help the public health care system. We don't want a deluge of patients going into the hospitals. And in fact, initially, when there was no ECQ, GCQ, the hospitals were already complaining. In Quezon City, for example, the biggest hospital would be the East Avenue Medical Center. And you have all the hospitals in that area, East Avenue, Heart Center, Lung Center, Kidney Institute, Children's Medical. They're all in that area. And yet, the capacity of those hospitals combined will not be more than 2,000. And so it was really to slow down. And I think we were able to witness the slowdown of the spread of the virus. The graphs earlier show the experiences that other countries had and the numbers that we have compared to them. In fact, these are countries with have excellent healthcare systems, supposedly, and yet there was a collapse. And I am predicting that in the opening of many areas from ECQ and GCQ, that really we will have a second wave. The data that we are seeing right now, I'm sorry to say, but in the case of the Department of Health, I think this is 2 weeks behind schedule. Initially, in Quezon City, for example, we saw many subdivisions having people being rushed to hospitals, people turning out positive coming from the subdivisions. But now, what we're seeing is our people being infected in the depressed areas. And the problem with the depressed areas is, of course, because of the proximity to one another, then you would have a situation where the spread is more potent than those in the subdivisions. In ACAS 1, for example, Oli mentioned this is a private group composed of, well, it's an organization composed of the different doctors from different hospitals, the military, private sector, the businessmen, professionals, and UP alumni, the academe. Initially, and in fact, until now, we were able to donate 127 face masks, 13,000 PPEs, 5,000 alcohol. Why am I mentioning this data? It is because the hospitals were the ones begging for support. We need PPEs, we need face masks, we need this and that. In fact, initially it was even food, because when many of the restaurants were closed, many of the frontliners could not buy food anywhere. And so, if there will be, if this happened again, what would have been the mistakes that we committed, or what could we have done? Well, of course, number one is we should have been prepared with our hospitals. To date, we have about, in the private sector, about 1,000 hospitals. In the public sector, about 500 hospitals. And yet, we do not have enough isolation rooms for them. Under the DOH, you have about 70 hospitals. when COVID was declared, only 5 hospitals were declared COVID hospitals, subnationals. These are one in Zamboanga, yung Southern Medical Center. Then you have NKTI, the Lung Center of the Philippines. RITM, of course, is there. And in Visayas, the Vicente Soto. PGH was not even named as one of those hospitals. We only had 5 hospitals. Of the 5 hospitals, there was only one testing center, which is the RITM. And initially, RITM was not even able to do testing. It's only after a month when it happened, when we were able to do the testing for them. The budget asked by the Department of Health during the deliberation was only for PPEs and gloves, and also for the improvement of these 5 hospitals. But now we understand that there should be testing for everyone, and all the hospitals nationwide should be capable. And I'm not talking about just the regional hospitals, but the provincial hospitals. There should be isolation rooms for all those hospitals, even on the provincial level. Why? Because COVID is not a simple sickness. When you have a hospital with COVID, all the other departments are affected. Dito po sa amin, yung PPEs, hindi lang COVID, kundi pedia, the other departments like OB-GYN would be asking for PPEs because they do not want to infect their patients and because they feel that they will be exposed. And so, for the isolation rooms, you also need, oh, is that my time already? So, now, last but not the least, let me just point sa health na lang, very clear legislation that we need. We need to increase the salaries of our medical practitioners, not the doctors or nurses, but all our medical practitioners. We need them now. Number 2, yung HFEP, Health Facilities Enhancement Program. Kasi po yung budget ng Department of Health, 20 billion a year. For this year, the budget was reduced to 5 billion and it was supposed to be given to barangay health centers to buy stethoscopes and to buy yung pagkuha ng blood pressure. We don't need that. We need to improve, at least at this point, the provincial hospitals. The disease control unit, it was mentioned earlier, kailangan po natin yan sa RITM so that now it is a continuing thing. We have to stop the case rate of PhilHealth. It is a source of corruption. I'm sorry, Dodo, for saying this, but I feel that it's a source of corruption. Dapat at cost. Kung ano yung cost ng pasyente, yun ang bayaran. And COVID particularly should be supported at this stage. And of course, there should be the universal healthcare law. The contribution there by the national government is 60 billion to date. It's 120 billion. We have funds for the PhilHealth program, but we should expand this further to ensure that we're able to address the problems such as COVID that we're experiencing now. Thank you.
Thank you very much, Congressman Mike. Of course, we can always count on you to really act proactively, especially during these times. Congratulations on ACTAS 1 and more power on that. And we will always be in touch with you for our health advocacies. Thank you very much. Moving along, next, what we have is, wait a minute, yeah. She is the president of Philippine Alliance of Patients Organization. This is a very important organization, and this is really a group, an advocacy group that represents patients. That's most of us. That's all of us. And we work with them in advocacies like in the cancer law, and they're also part of the DOH Advisory Council. Please welcome Ms. Maria Fatima Lorenzo.
Hello, good afternoon.
Hi.
Hi, thank you. The Philippine Alliance of Patient Organizations, or PAPO, represents about 1 million patients and is a growing movement to strengthen the patient's voice. Can you hear me? PAPO is an umbrella organization of at least 32 patient groups in the Philippines and is a member of the International Alliance of Patient Organizations, IAPO, a unique global alliance of national, regional, and international groups representing patients. Our mission is to help build people-centered healthcare in the country so that the healthcare system is designed and delivered to answer the needs of patients. In the Philippines, we're currently advocating changes in 3 areas: respect for patients' rights, universal health coverage, patient participation in health policy making. We thank Stratbase ADR Institute and CitizenWatch Philippines for inviting PAPO to be a reactor in this discussion. We agree with Dean Ron Mendoza's proposal of having an inclusive health-anchored economic recovery. And for us in PAPO, inclusive means patient leaders are involved in crafting health policies. Our wish is that our involvement does not start and end with mere consultations, but a sincere partnership and shared leadership where patients have equal representation in policy-making bodies, which makes decisions about how to allocate resources to health programs. Just an example of this during this pandemic, we are the ones who know what is happening on the ground. For example, our cancer patients during this enhanced community quarantine, they had a lot of treatment delays because the hospitals were filled with COVID patients and there was no preparation for cancer patients, for the continuing treatment of cancer patients. Same goes for dialysis patients. There was no transportation for patients, so they could not go to their hospitals. So you could see that some who were already recovering had relapse in their disease. So that's why it's important that we are involved when health policies or strategies are created. Dr. Sherwin Ona spoke about the strategy of mobilizing various stakeholders versus government-centric approach. Trust is the driving force for various stakeholders who want to be involved in a program. Using the police force to enforce enhanced community quarantine and a spokesperson blaming the Filipino citizens for a high rise of COVID cases does not establish trust. UP Dean Michael Tan, in his lecture on health, beliefs, models, and behaviors said that instilling fear and punishment creates resentment rather than motivation to change behavior. We propose that social scientists and anthropologists should be also consulted with crafting health policies and strategies. Let this be part of the new normal in crafting policies. They have invaluable insights on how to sustain behavioral change. And we hope the government leaders can work on regaining the people's, albeit patients' trust by providing an enabling rather than punitive environment and be accountable for government funds. Dr. Dodo Banson spoke about the new normal in universal health care. The enhanced community quarantine has shown the value of supporting local chief executives in the delivery of healthcare services. We hope the national government invests time and resources in training our local chief executives on health governance and strategies. In the war against pandemic, they are the foot soldiers who are responsible for the safety of the people on the ground. We, the patients, will highly benefit if local chief executives are knowledgeable on good health governance. And we hope that the local governments will institutionalize patient groups' feedback mechanism on health programs. In closing, we wish to reiterate that in the new normal, we hope we, the PAPO, patient leaders, can have shared leadership where patients have equal representation in policy-making bodies, which makes decisions on how to allocate resources to health programs. Thank you.
Thank you very much, Fatima. Yeah, we totally agree. As patients, that's all of us. We really need to have more representation in terms of policy. Going to our next reactor, we're really very happy to have him here. We've been working together, especially with the very successful project Ugnayan, and again supporting the project of T3 with the PDRF. Please welcome the Chief Resilience Officer of the Philippine Disaster Resilience Foundation, Mr. Guillermo Bill Luz.
Thank you. Thank you, Orly. Thank you, Dindo, for the invitation. I must say at PDRF, at the outset, in the very, very early days, we looked at COVID or coronavirus, there was no name yet for it, as a health problem. So I look back at my calendar, and on January 24th, PDRF held a forum for its members to talk about Taal volcano, actually, because at that time it was in stage 3 or 4. And but at the last minute, we added a speaker from the Department of Health to bring us up to date on what was happening with coronavirus. And at that time, there were no cases in the Philippines. It was only 1 week later that we had the first 3 cases reported in the Philippines. And the numbers coming out of Wuhan were in the very low double-digit numbers. Fast forward 7 to 8 weeks, and we were in ECQ. We were in lockdown 8 weeks after that. So by then we had changed our outlook and looked at it as both a public health issue and an economic issue. It will have economic repercussions. One of our concerns was that just on 1 month of ECQ, we were wondering how people would go about, and they had no livelihood, no jobs, their savings would begin to run out. We thought, how could they get food on the table? So the business community actually first focused on an unconditional cash transfer program to the poorest of the poor, selecting the lowest income barangays in Greater Metro Manila, which included Rizal, Bulacan, Cavite, and Laguna. And thus was born Project Ugnayan. We gathered a handful of companies, about 2 dozen of them, and then eventually that grew and grew and grew. And we were able to raise 1.7 billion to start the project. And we started a cash transfer of 1,000 peso gift certificates to people so that they could actually go shop for grocery items. So these are supermarket vouchers. We were able eventually to deliver to 1.4 million families. And by bringing on other partners like ABS-CBN, Jollibee, and ADB, eventually that reached 2.5 million families as of this weekend. So that's about 13 million or so people in that first period. Of course, little did we know that we would see the ECQ extended by an entire month since we projected our original date. No? From that time, we started shifting to public health concerns for the business community. And one of those concerns had to do with testing. We felt that everyone talks of COVID as an invisible enemy, but actually testing makes it a little more visible. So if we were we felt if we were using a combination of rapid test kits, no matter what possibilities for false positives and negatives were there, and if we use that in tandem with PCR tests and more tests, we would be able to get a clearer picture of what's happening on the ground as far as the spread of the disease or the contraction of that spread. So we started to get heavily involved in this. Dodo already mentioned a program to ramp up the PCR testing. A month ago, it was about 4,500 or so tests per day. Target was set to try to move this to 30,000 by end of May and 50,000 plus by end of June. So as of today, we're roughly around 15,000 as of May 15th, just under 15,000. We'll be at 28,500 tests a day by end of May and 50,000 tests a day by end of June. And here we begin to see a public-private partnership take hold. This is a combination of work of IATF, Department of Health, ADB, the private sector, to make investments either by donating equipment to existing labs or actually even building new labs, so to augment the existing number. So a number of companies, Ayala, Unilab, MPIC, the Philippine Red Cross, San Miguel have come on board to actually build labs, but they've also donated equipment to existing labs. Project ARC got created and has ordered 1 million rapid test kits so far. About 15% of that will be donated to the public sector for testing at the barangay level. So we felt that by testing, we would get a better view, a better, clearer picture of what's happening. We also noted that there was a big shortage of PPEs. Like many of you, we have been donating PPEs, but the government wanted to build up a bigger buffer stock of a bigger inventory of PPEs in anticipation of a spike once they lift the lockdown and shift from ECQ to GCQ. So we were given a target of how many PPEs to raise. And we knew that 95% of PPEs were imported, but we wanted to set up a local manufacturing base of PPEs for 2 reasons. First was to secure, create a bit more stability in the supply. And second was, of course, to restart and reboot the economy and get jobs going. This morning, we had our first call on a manufacturing forum of Task Force Protect, which is composed of DOH, DBM, DTI, Board of Investments, Philippine Chamber of Commerce, PDRF, Ayala Corporation, and others. And to my surprise, we had 70 people on the call because people are very interested in manufacturing, and they'd like to find out how to get medical grade equipment, how to get medical grade fabric, so they can produce the PPEs locally. And we thought of not producing this during a crisis period, but of creating a whole sub-industry category of PPE manufacturing, potentially for export eventually. And then we need to backwards integrate into thinking of the textile industry. So we think that this project shows promise. I think some issues in our mind have to do with things like cost of the tests and the algorithm used for testing people. So when tests were in short supply, DOH has strict sort of criteria or algorithm used for selecting people who would get tested. Essentially, these were symptomatic people. They were the PUIs, PUMs, people with some travel history. But there are many asymptomatics out there who are not tested. So we thought that as we expand, we're hoping as we expand the testing capacity, people will get a chance to be tested. And hopefully we also see the costs go down. One of the issues we see with high costs for testing and the issue of having to pay for your own tests if you don't fit the criteria or the algorithm is that people will not choose to be tested. So they will just remain in hiding, and we could have people roaming around there who are asymptomatic but positive, who refuse to be tested and continue to spread. So I think this is a serious issue we need to be looking at. As we move towards return to work and a percentage of workers are allowed to get back in, I think they will need to be tested so we don't mix the positives and the negatives together and unwittingly spread coronavirus or COVID. On top of that, I think and private sector is participating in other projects that would include more random surveys and what they call the serosurveillance surveys, random testing, so that we know the spread of the disease. This is more like just to find out trends, contact tracing, and of course the quarantine centers, which Dodo mentioned. Going back to the economy now, because it is an economic problem now, we know for sure that the savings have been depleted. Savings of many people have been depleted, and it's going to be interesting to see what the net effect will be on people and people's lives and on the economy. And sort of 2 questions come to mind very quickly is that how many of the companies which are shut down will actually reopen? Will they be able to reopen? And how many of the temporary job loss becomes a permanent job loss? If the trends go negative on us, then we're going to be in very, very deep trouble, and the economy will be in for a huge shock and disruption if people lose jobs, if businesses can't recover, and if savings are depleted. If unemployment goes up, poverty goes up, we're in deep, deep trouble. I'll end on a positive note, which is where I think an opportunity lies, and that opportunity lies in going digital. We've all become dependent on digital-enabled services and businesses. Dr. Bev already mentioned the impact it can have on the public health sector, but this cuts across many, many industries. But I'd like to think that the biggest user of this change should be the government. If the government were to go digital and automate more of its systems, we're going to come away out of this crisis in much better shape. But we have to take advantage of this trend and make use of it. Thank you.
Thank you very much, Bill. Yes, the partnership that I think will not just be very valuable today, but will be very valuable as we try to get to recover our economy. Next, what we have is, let's hear from a reaction from the pharmaceutical sector, which is playing a very important role right now. I'd like to welcome the Executive Director of the Pharmaceutical Healthcare Association of the Philippines. Please welcome Ted Padilla. Ted? Hi, Ted.
Hi there, Orly, and good afternoon, everyone. Just a second, let me just. Okay. So good afternoon again. Now, what we noted is the speakers this afternoon have very much emphasized that the COVID-19 pandemic has reminded all of us that healthcare is a matter that we should prioritize as a nation. The implications of this pandemic are now beyond public health. The consequences are huge. That is why globally, we are seeing unprecedented collaborations and new ways of doing things. PHAP, or the Pharmaceutical and Healthcare Association of the Philippines, is a group representing the research pharmaceutical sector. We are pleased to inform everyone that many of these companies that have reinvested and doing research on COVID-19 have a presence in the Philippines. As we speak, manufacturing capacities are also being prepared to scale up production once medicines and vaccines have been developed and approved for use. We are committed to the Filipino patients, and we want these medicines and vaccines to be made available here as soon as these are developed. At the moment, there are 133 potential treatments under study, 82 candidate vaccines under preclinical trials, and 7 candidate vaccines under clinical evaluation. Like other sectors, the research pharmaceutical industry is also pleading for support. In our desire to make medicines available despite the global lockdown challenges, we continue to operate and have significantly been impacted by this crisis. Throughout the ECQ, we continued making available medicines in hospitals, clinics, and drugstores because we know what the consequences would be for our people. COVID-19 and the ECQ pose significant challenges to the industry, affecting our operations and the way we make medicines available. As one of the speakers pointed out, the economic recovery plan to create jobs, sustain economic growth is still in the works. We would have wanted to hear the government's plans to support the industry and provide economic relief. While we strive to contribute and remain resilient, our costs and expenses have substantially increased. Amidst lockdown situations here and abroad, PHAP member companies are ensuring that their manufacturing capacities are at optimal levels despite challenging circumstances, keeping the plants open to maintain a steady supply of medicines. These companies have endeavored to transport and distribute medicines across checkpoints implemented through varying local ordinances, travel restrictions, and even including port closures. New logistical arrangements had to be sought, including chartering flights to transport medicines and medical devices in a timely manner given the public health emergency. Normally, medicines are transported as cargo via passenger planes. Chartered flights are significantly more expensive, increasing costs by at least 10 times, and companies needed to consolidate deliveries to maximize the air transportation. Companies are also managing their inventories, including redirecting supplies from Australia, Hong Kong, and other neighboring countries and markets towards the Philippines. These rising costs are projected to continue as the pandemic continues to evolve, alongside our determination to also keep our people who themselves have been frontliners. Economic relief pertains to also shielding us from the impact of the pandemic because we still have a long way to go. Our members have started clinical trials, but until a treatment or vaccine is found, we will have to operate with major limitations. We appeal to the government and to our partners here today to explore alternative solutions to improve access to medicines. These solutions include pooled procurement and price negotiations that are hallmarks of the universal healthcare law. Expanding pooled procurement and utilizing multi-year contracts will further increase volumes in purchasing medicines, giving the government stronger leverage to negotiate. Lastly, institutionalizing price negotiation provides alternative mechanisms to bringing down price. These can be done through a committee that can review prices and determine economic viability and proceed to negotiate with individual companies. We believe that it is time to implement these policies. If we start doing these now, instead of mandating price reductions through a maximum retail price order that companies can no longer sustain, we can collaborate to achieve the same objective of greater access to medicines at an affordable price. This is aligned with the effort to build pharmaceutical security, as mentioned by one of our distinguished speakers. Around the world, we have seen unprecedented collaborations among governments, the academe and various institutions, patients, and the research pharmaceutical industry. It is also our aspiration to see the same level of collaboration here in the country. Building capabilities for advanced science, technology, and innovation, formulating policies that enable, support, and incentivize innovation, and forging public-private partnerships on pharmaceutical security and improving access to medicines are necessary steps to achieve this. We also ask for your support as we help ensure the uninterrupted supply of medicines and vaccines for COVID-19 and other diseases that afflict Filipinos. We hope to start quickly collaborating with you. This is a real whole of society approach, and we are ready to be part of the solution. Thank you very much.
I think Mr. Ojal is on mute.
Oh, hi, sorry about that. Hey, hi Ted, thank you very much. Really nice to hear that we're all working about improving access and affordability of medicines. Well, your industry is very important right now, and we really hope as consumers, as patients, that you will be able to work as an industry and the government to really help us get out of this crisis. Next, let's hear it again. We're going to hear again a very important sector. It's from the healthcare sector. Let's hear their reactions and their inputs. Please welcome from the President and CEO of Ayala Healthcare Holdings Incorporated. Please welcome Paulo Borromeo. Hello, Paulo.
Hello, good afternoon. Can you hear me?
Hi, good afternoon. Welcome.
Good afternoon. I actually had a deck to present, but I noticed no one was presenting documents, so no need. I'll just read through it. But thank you for inviting me here, and good to see familiar faces in the crowd. I'll echo a lot of what our guests and panelists have been saying, and focus maybe just to keep it short, or really focus on how what we're doing as a group, which Bill had already mentioned, but to our perspective on the industry, the healthcare industry, both our response to COVID as a country, and then what we believe the industry will look like moving forward. I think first, just to say that we believe that healthcare, even before COVID, really needed massive support. And our belief at Ayala is Filipinos deserve better care. No? And this has become clearly apparent amidst COVID. As Bill mentioned, we've been focused on protecting our employees. That's been our fiduciary duty. And at the same time, providing care to our many customers and patients. A few examples of what we've done at Ayala, just to highlight. One, deploying digital facilities and telehealth capabilities, both for our employees and for our customers. Two is we've been committed to maintain our clinical network and open our clinical network throughout this crisis. We call it our extended frontline. So we've kept open about 60 family doc clinics and 6 healthway clinics open to serve COVID and non-COVID patients. 3, we've been working very hard Hello.
You're back.
Hi, sorry. Where did you lose me, Orly? Was it on number 3? Maybe I'll just continue where I left off. Can I be heard?
Yes, loud and clear.
Okay. I guess I was saying that the second is we've kept our clinics open. The third is we've kept our pharmacies open, recognizing that it's important to be able to deliver essential medicine at this point in time. I'm sure the other pharmaceutical, I see a lot of common faces and common names, would agree that there's been a massive increase in demand throughout COVID, and it's really shocked the entire supply chain. So I think what's been important for us is to stabilize our own supply chain and be able to meet the significant growth in demand. Fourth, in terms of facilities, we've established new facilities. One, building the World Trade Center for the government, and then 2, expanding our own hospital in Nuvali to be a COVID referral hospital. And then finally, as Bill mentioned earlier, Bill Luz, we continue to support government by building additional PCR labs and rolling out a large-scale corporate testing program that we are currently doing. Maybe I'll end by saying a few thoughts on our healthcare system, and both today and how we anticipate things moving forward. Number one, I think it's important to note that there has been significant public health momentum prior to the crisis, but unfortunately, those have been stalled, and the pandemic has exposed some significant gaps in our healthcare system. I'd be remiss if I didn't mention the excellent work that the DOH has done prior to the crisis, especially with the Universal Healthcare Law and the Cancer Bill. Unfortunately, these have not been fully implemented, but we hope that these would be executed moving forward. That said, the pandemic has shown us the inadequacy of the healthcare system. Number one is insufficiency of facilities. So when you look at our inpatient and ICU beds, at just the number of laboratories, especially biosafety 2 labs, but most importantly, in terms of manpower, in terms of not just the doctors, but allied professionals, med techs, and across the board, and not just the lack of it, but the unequal distribution geographically. Number 2, it also showed us that there's a need for better coordination between and amongst the public and the private sector. And number 3, there's a clear there's a lack of data capture, and the proper analytics and interoperable technology requirements that would have been nice to have, so that we can properly share data and analyze that throughout this crisis. Nonetheless, we've learned throughout the crisis And as an entire country, both public and private sector, we've been taking steps to address the gaps. It's been a delight to see how everyone is coming together and adjusting and adapting as needed to meet the crisis head on. No? And more importantly, the pandemic has shown us how vital healthcare really is to nation building. And at Ayala, it's renewed our own commitment to the sector. I guess I just wanted to say too, Orly, that our views on the sector locally, without overstating the obvious, it will face massive disruption and consolidation moving forward. No? And as a group, we're committed to investing in the sector moving forward. We look at it across the entire value chain, from the clinics to the hospitals to the pharmaceutical space, all the way to the digital side. But clearly, there's significant capacity and capability building that's required across the sector. And this will require committed investments from both the private sector and, of course, the public sector. That said, we anticipate a mixture of organic and inorganic opportunities, and really a lot of promising opportunities for partnership and consolidation to create scale, impact, and efficiencies. We believe that healthcare of the future in the Philippines will require large-scale integrated ecosystems along the lines of what universal healthcare was envisioning, but in order to be able to deliver affordable products and services, especially where patients need them and when they need them. Our own vision of the future, 4 things. Number 1, we believe very strongly in the power of distributed clinical networks. And distributed clinical networks for both communities, families, as well as employees, but really with broad reach, broad distributed reach, where people need them and when people need care. Second, we believe very strongly in the long-term potential of large-scale specialty hospitals for depth and smaller multi-specialty hospitals for breadth. So we believe very strongly in the importance of specialized hospitals, especially in metro areas, and multi-specialty hospitals in more regional and tier 2 cities for breadth. Third, continued commitment towards affordable diagnostics and affordable medicine for everyone, which we can do with a more efficient supply chain and a more efficient distribution system. And finally, a stronger digital health and data analytics environment where we have platforms that can integrate and interoperate and really tie everything together. But the key is for the build out of these integrated healthcare ecosystems to be able to deliver better care moving forward and protect us from future pandemics. That's all I have, Orly. Thank you very much.
Thank you. Thank you very much, Paolo. That was really, really important to hear. That we do agree that there's really a significant and big need for building up our capacity and a lot of investment that's going to be needed. Next, we're going to have from the same sector, the head of COVID crisis, the head of the COVID crisis team of Metro Pacific Hospital Holdings Incorporated. Please welcome Attorney Pilar Nuca Almira.
Thank you very much, Orly. Pleasant good afternoon to everyone. I'd like to congratulate the 3 speakers that we have had. They have been very informative in their presentations, and indeed, these are my reactions. From the presentation of Dindo in his introduction, I believe that really the healing power is on collaboration, and that there is a need for us as a whole society to move, to be able to address the COVID. And this is very important because engaging everyone is what is needed now. And this forum is one way by which we are engaging all sectors of society. From Dean Ron Mendoza, I also agree that we have to strengthen the capability of the health sector, particularly the hospitals, the clinics, and most especially the government hospitals and other healthcare institutions. We have to prevent a relapse, that's what he has said, and that we should be able to usher to investment healthcare in the Philippines. Therefore, it is important that we proceed with no fear. We have to prepare all of us for possible surge. And the moment this lockdown is lifted, indeed, a surge is a risk and it's an imminent threat. From Dr. Ona, I believe that the securitizing the public, this is very important. And he has emphasized that it is the one that will have to make people live, and beefing up also the medical industry will support that. Policies are needed to strengthen the national and local ties. And most especially, we need the LGU to participate in educating the people so that
Hello, hello, we lost you. Hello?
Prioritization of our people, probably they will be able to participate more, and this could address as well the economic concern that we are seeing from the pandemic. From Dr. Banson, indeed, he discussed about testing, contact tracing. These are all important. Improving the capacity for the healthcare industry, particularly the government and the private sectors, to increase testing capability. And yet, my thought is that when we do this, we should understand the continuum of the entire process. First, who are to be tested? Who from those who are asymptomatic should be tested? What sectors in the government? Because our testing capability is very limited. And therefore, after having been tested, who are the people to do contact tracing? Are these people capable of contact tracing? And once they have been traced, what do we do with those people who have been traced? And after they have been traced and tested and found to be positive, what do we do with them? So this must be seen as a continuum and a process that really needs an end-to-end perspective. This is not simple because we need the profile of the tracers. And we have to deal with those who have been traced. And one particular issue here is the aspect of honesty and trust. Because if people do not trust the tracer, do not trust the testing, they will not go for testing. And if they do not trust the people talking to them, they will not reveal the truth. And if people have fear, they will not even say that they have been in contact with one who is positive. And therefore, it will make everything futile and useless. That's why this has to be seen as a continuum in terms of handling the entire program of testing, tracing, and treating. Now, we really have to fight the fear. It is the fear that is more important now, as I see, than COVID. People are afraid to work. They are afraid to move. They do not want to risk anymore because they might be contacted with COVID, or they might be admitted in a hospital, and they have the picture of what could happen. Look, what has happened is, in the hospital, we have been beaten. Although now it's a good news that the COVID patients have been going down. It is because people now, out of fear, they just try to stay home, cure themselves, and they have been educated with a lot of communication, with a lot of knowledge being spread about COVID. They have taken upon themselves to do self-care. That's why even if they think they have the symptoms, they just stay at home and make do how to care for themselves. And they don't go to the hospitals anymore because they know what's going to happen. And of course, there will be cost. And because of the PPE, the cost of hospitalization going to the ER have gone up. So what has happened? The hospitals, the private hospitals have taken the beating. We are losing, and it's difficult. Why? We don't have the census. Why don't we have the census? Because we are on lockdown. The doctors do not report to hold clinic. The patients do not come to the hospitals because they might be, what? The virus might be in the hospital, and they might contract the virus in the hospital. So no patients, no doctors, nothing. The hospital is practically rendered to be useless other than treating the COVID patients the COVID patients who are feeling helpless already. Because if they are asymptomatic or they are just suspects, they just stay at home. They isolate themselves. And the Department of Health has encouraged the asymptomatic, the suspects, to stay at home, isolate themselves, do self-quarantine, so they don't go to the hospitals anymore. So what happens to the hospitals? Yet, the hospitals are now encouraged to what? Increase its isolation rooms because there could be a surge of COVID patients once the quarantine is lifted. They are encouraged to make sure that there are health workers who will attend to COVID patients. And look, the hospitals have to make sure that it is complete with PPEs, and PPEs are not cheap. They are expensive because that's covering from head to foot. And so how does the hospital manage this? And the hospital cannot just be charging the patients tremendously high because the patients also do not have work. They do not have jobs, and they are really just working on their savings. So how do we deal with this? That's why the presentations of our three speakers are very meaningful. We leave freedom, maybe deal with the economy, help the medical industry, help that we are able to produce our own PPE so we don't have to import and we don't have to wait. Now, I'd like just to share with you, all of you, what the 16 hospitals of Metro Pacific Investment Corporation has done. We created a COVID task force, and that's headed by me, and we meet weekly. We make sure that we are in touch, connectivity is tight, so that we anticipate day by day what is happening. We track all the COVID patients that go to our 16 hospitals so that we can do decision making. We have decided that all of us will increase our capability to deal with COVID patients, isolation rooms, ventilators, PPEs, etc., and we even reinforce the hiring of nurses. Nurses who have less in the hospitals with less COVID patients in Mindanao and Visayas, we encourage them to come and join us from our hospitals in the south so that we can reinforce the healthcare professionals in our hospitals. We also have made a direction that all our hospitals will be capable of testing, standard PCR, gene expert, all of this, all the 16 will have to be capable because we understand that we have to support the government in increasing its target to 30,000 this May. Yes, we would like to be with the government and help. So even in PPEs, we mobilized our logistics that each hospital will have a stockpile good for 3 months of PPEs because we have to allay the fears of our healthcare professionals, our doctors, our nurses, medtechs, and so on and so forth. Why? Because if they are afraid, they won't report anymore. Number two, if they report and we don't have PPEs, what happens? They get contaminated, and once they are quarantined, who health workers will operate the hospital? And it's now saying that we as hospitals, we have to monitor our data, respond day by day. We also have to make sure that we protect our healthcare professionals, doctors, nurses, aides, janitors, our housekeepers who clean the rooms. They are all vulnerable. So we have to make sure that we do protect them. And yet we have to strike the balance that given the cost that will be incurred by the hospital, how do we deal with our cash flows, with our revenues to be able to do all these things to prepare for COVID patients to come? So this really requires very strategic moves from the healthcare, particularly the hospitals in NCR, which now has the highest number of positive COVID patients in NCR, and we hope that also in the Visayas, in Cebu, the hospitals in Cebu should be able to handle this. Now, I'd like to end by saying that indeed, we have to be able to bring the care of the patients to their homes. We have to do medical services and bring this to the patients at their homes. That's why, for example, in Cardinal Santos Medical Center, we have Cardinal on Wheels. Now the medical services are brought to their homes because of their fear to come to the hospital. Indeed, we are also doing one thing. I'd like to leave two things before I end. One, it's very important that we now empower all our patients. And we, not just the patients, but the prospective patients. We have to empower them to take good care of themselves. And second, the one that can really address this, even if there is no vaccine, education of the public towards prevention and accountability for their health. So with that, I'd like to end by thanking all of you. Thank you, Mr. Dindo Manhit, for inviting us. And thank you all of you for allowing me to share these thoughts this afternoon. Back to you, Orly. Thanks.
Thank you very much. Thank you very much for that very interesting input. Yes. Next, we have also from the pharma industry, one of the important companies now. Please welcome on board the country head of Boehringer Ingelheim, Yi Kok Chong. Yi? Hi, welcome. How's his mic?
Hi.
Hi.
Could you hear me well?
Yeah, it's good.
Could you hear me well?
Yes, a little louder.
All right. Okay, thank you. I go a bit nearer to the mic. Thank you, Ollie. And thank you, ladies and gentlemen, for having me in this session. For a start, let me give you a brief introduction of our company, Boehringer Ingelheim. We have started our operations in the Philippines in 1962. That's close to 60 years ago. And today we employ close to 550 employees, encompassing our business area, human pharmaceuticals, animal health. And recently, 2 years ago, we decided to set up a second office in Manila. That's called the GBS Center, the Global Business Service Center, that provides support in terms of finance, human resource, and IT to the global BI affiliate companies. So during these 2 years of a very rapid ramp-up stage, we anticipate that by the end of this year, our total employment will rise to 650. And if I go further next year, our plans is to increase it to 750. Early today, I'm very glad to hear from our speaker expert, Mendoza, that the intention is really to support the economic stimulus plan to revive the economic situation in the country post-COVID-19. So we believe that with all these strong support in terms of health investment, our company's growth plan will remain intact. Thank you very much. Essentially, what I want to share with you today is to talk a bit about what we have done in the last 9 weeks since the ECQ has been enforced. Firstly, talk about our stakeholders, and the nearest stakeholders to us will be the employees ourselves. In fact, before the ECQ, we have already provided the PPEs in the form of face masks and hand sanitizers to our employees. With the declaration of ECQ, immediately we asked all our 100% of our employees to work from home. We equipped them with IT devices and the latest software. For some of us who has internet connectivity problem, we provided them with pocket Wi-Fi. I mentioned to you about the GBS Center, the Business Service Center. These people are working in front of the computers for an extended working hours, 8 or 9 hours a day. And some of them are working at night shift. So we support them by providing them a second screen. And we are in the midst of sourcing for ergonomic chairs for them. So in the gist, we are trying to make life, working life easier for them who is working from home. But what I really want to share with you is, as a BI Boehringer Ingelheim employee, I'm proud to share with you that the company has offered a 10 days of paid leave to all our 51,000 employees worldwide to volunteer work related to COVID-19 in 2020. Yeah? So this is part and parcel of our efforts to encourage a high sense of volunteerism. On top of that, in parallel, we are also very well aware of the needs of the patients that we serve and the medical frontliners. Our objective from the outset is really to ensure an uninterrupted supply of medications to our patients. You heard from Mr. Ted Padilla just now, challenges in shipments, in logistics. There is a lot of considerable workaround that has been done with regards to shipment, especially to Visayas and Mindanao. There is a considerable change in terms of production planning. So this requires agility in response to the changes brought about by COVID-19. In the initial phase, the shipment that we sent out to Visayas in Mindanao had to be sent via chartered flight. You heard just now, it cost 10 times more than the usual commercial flight. But we believe that this is the time for us to step up, and we just did it. So that's what we have done essentially in the gist, without going into too much detail. We have also not forgotten our medical frontliners, the society, and the underprivileged group. We are happy to share with you our Boehringer Ingelheim Global Support Program has to date contributed 5.8 million euro in donation in kind and financial aid. For us, Boehringer Ingelheim in the Philippines, just to share with you, we caters lunch for our employees. Well, with the working from home approach, the lunches are no more necessary. But we also realize our caterer needs to survive, they need to do business. Then there was also a couple of requests because of disruption to meals and food supplies, to hospitals, to homes. So the idea is really to utilize the lunch budget that we have. We continue to ask our caterer to prepare and deliver the food, firstly to SOS Children's Village in Alabang, and also to the medical frontliners. I'm a board member of PHAB as well, together with Ted Padilla and two other colleagues that are in the panel today. In total, the industry association PHAB has introduced a program called our CSR response to COVID-19, and our tagline is we will not rest until we have served our frontliners. To date, we have collected, or we have raised above 8 million peso worth of support in terms of PPE and also in terms of funds, financial support. So we are looking at providing the PPEs. We have identified at least 12 hospitals that we are going to provide these PPEs. And on top of that, we have also delivered some vitamin C's to the to the frontliners at MMDA. So that's also very much appreciated. And our efforts continue as we speak today. So this is essentially what we are doing. And on the medical technology side, we have a couple of collaboration globally. We collaborated with what we call the European Union Innovative Medicine Initiative. We collaborated with the Bill and Melinda Gates Foundation through what we call the accelerator, therapeutics accelerator. So this is also part and parcel of our efforts globally in Boehringer Ingelheim. On the global research basis, we are currently engaging 100 of our scientists to screen to 1 million compounds that we have in our documents, in our libraries. to identify molecules that has activity in terms of antiviral. So many of those research development, research efforts that we are doing today to support as an industry also countering the challenge of COVID-19. So finally, before I sign off, our request or our intention is to share with you the issues that we face. One is in terms of logistics and shipments. We hope that the country, the government, the agencies going forward will be able to support us in ensuring that our supplies goes to the place that is needed unimpeded. So that is one of the asks, and of course to create, to nurture a strong and a positive business environment for the pharmaceutical industry, because we want to contribute to the economy, we want to contribute to the well-being of the Filipinos in this country. So basically that's about it. Of course, we can go further. There are also many other priorities that we are looking at, and all of us are looking at how do we prepare ourselves going back to work. So many of those considerations, we are looking at data, we are looking at models, we are looking at guidance from governments. We recognize that the environment in the Philippines is very much different, and the cultural difference. And we need to be agile in terms of coming out with our pandemic recovery plan. So again, adjusting to new normal is something that we need to talk about much more closely, and in a forum like this, that's where we need to share with everybody and to hear from everybody what can we do to ensure a healthy going forward, in a healthy country, a healthy community going forward with the threat of COVID-19. So thank you very much, Oli. Hand it back to you.
Thank you very much, Yo. That is very good. Next is also from the pharma industry, one of the very important players, especially for a lot of our very important medicines in cancer and also the test kits. Please welcome the country head of Roche, Cara Brotmarko. Hi, Cara.
Hi, Orly. Thank you.
Hi.
Really appreciate the invitation to provide a perspective here on behalf of Roche. I think the comments so far have been really interesting and good thought-provoking dialogue. I felt like there was a lot where I saw common thoughts, because I think we have a common objective of supporting our healthcare system and patients through this challenging time. And I really think that how well we work together going forward is going to very much be linked not only to the health outcomes, but also to the country's economic security, as we were hearing earlier from the speakers. So when I think about, how do we want to move forward, I think this is really a good time for us all to be pausing to reflect on the strengths that we've seen, but also areas that we'd like to strengthen further to get to where we want to go. And, I really start by thinking about what does good look like? And, obviously what we would want to see in some of the systems that were referenced earlier, I think have achieved this is a fast and flexible system that's capable of quickly mobilizing resources for surge capacity while not compromising the care of others who rely upon the healthcare system. And I think we can do that by leveraging things like data and health technology to get the country and the economy going again very quickly. Now, when I think about, the Philippines, and from my perspective, the things that I think are strengths for us in this situation has been the political commitment to protect the health of the people. And it was mentioned several times about the UHC, but also the National Integrated Cancer Control Act that were passed last year. And I think this was already a signal from the administration that this is really a strong priority. And we've seen it again in terms of how quickly the president and his cabinet have acted to take action to lock down, understanding where the health system was at and make sure that we flatten the curve. I think in addition to that, there's also been strong coordination and rapid adjustment here. The IATF has allowed for centralized coordination and fast decision-making, and we've experienced that on our side when we were trying to get some of our supplies into the country for some of the drugs that were being used to treat severe COVID patients, and very grateful for the fact that we had responsive partners in FDA, the DOF, the BOC, our distributors, many of the industry partners here today. It was very humbling to see how the whole system mobilized to very quickly be able to ensure that those medicines got to patients within a day of them arriving in the country, despite how many steps are involved and how many people are involved to make that happen. And I think another great example of coordination and collaboration here is the T3 initiative that was mentioned earlier. So I really would think that this is something where we want to see more of that going forward, because it shows how powerful it can be. And we've seen quick learning as well. I think, going back to the beginning of this crisis, when we were trying to get the approval of the initial PCR tests, we saw that it was taking longer than in some other countries, but in the most recent approvals, it's been incredibly fast, and in fact, faster than some other markets, both in Asia and in Europe. And I think that's really important because it allows us to get supplies here very quickly to meet the country's needs. So I think these are the areas that have been strong, and nothing's perfect, but I think there's definitely some of those examples to look at. The areas that I think we can further strengthen, and here I'll also highlight a little bit of what we're doing, because I think, obviously if we identify that there's something that we can strengthen, then we have a responsibility as a healthcare partner to also do our part in doing something about that. The first area is investment in health infrastructure and innovation. And I think, when it comes to infrastructure, it's really about preparation. Like many things in life, preparation is a good predictor of performance. And if we haven't laid that groundwork in terms of the diagnostics or the data or the people, then it's really hard to rectify that in the middle of a crisis. And so I think, by putting all our efforts into that, we can definitely catch up. But, what's the lesson that we learned from that in terms of how we move forward? Equally, I would say the same about valuing innovation. And despite the really positive example that I shared earlier about quick approvals, our typical experience is that it can take sometimes over 2 years for innovative products to gain approval. And I believe that we can do better to ensure that Filipinos have access to the standards of care that are available to the rest of the world. And we're really committed to making sure that that happens. And right now, obviously our focus is a lot on COVID, and I'm very grateful to be working alongside our people in our company who've just shown, I think, tremendous commitment to supporting the frontliners. We do have service engineers who have to go into the hospitals to service the instruments so that they can run the tests. And they go in, of course, to support that. But we also have people that are working around the clock, literally, to ensure that we support our hospitals and our frontliners to make sure they have the medicines that they need. Now, of course, we did have the first globally approved PCR test, and we've supplied 17,000 of those tests here. We have a best-in-class antibody test that's arriving as well. And we're working to enhance the capacity by getting faster test solutions, and of course, ensuring the continuity of medicines that are being used to treat. So that's what we're doing now, but I think for the future, it's not just about how we bring the diagnostics and medicines to market, but also how we work on ensuring access to those through our programs that we have for patients. And I think there's also an opportunity here. We are going beyond those traditional things to think about digital and data solutions, such as platforms for registries that would allow interoperability across and an analysis of data across the system. And these are things that can really be provided for more or less just at the cost of integration. So these are areas that, there's an opportunity for strong collaboration and problem solving, I think, across sectors. And the second point is just around system resilience. And I think that really can be strengthened through the collaboration that we've seen recently and having that continue. And, here, I just want to mention that our system has been consumed by COVID, but there are a lot of other patients out there, and they are experiencing disruption, and many of them are the most vulnerable, such as the cancer patients. In the immediate aftermath of the lockdown, we saw that at least 50% of our patients were experiencing some sort of disruption in accessing their care. And you can imagine how anxiety provoking that is at this time. So, this is one area. Knowing that our systems were consumed with this, we were able to step in and ensure that we provide safe transport for those patients to get their medicines, to get to the doctor. And we are working on partnerships for solutions to help also relieve the system of the capacity challenges, such as telehealth, alternative centers, or even home administration. So, I believe that the Philippines healthcare system is more capable of being able to take care of all of the patients. There are 86,000 cancer deaths a year, so that in and of itself is its own pandemic. But we would also need the full system working to support that. So I think, I wonder how might we manage to work more comprehensively so no patients are left behind in this situation. So obviously, I think a good response and recovery requires continuous and sustained investment in health, infrastructure, in data, a commitment to value and innovation, and open collaboration. And my last point is just that I don't think any of this is out of our reach at all. I think it was mentioned several times, but I think we have very good and solid foundations in place with the Universal Healthcare and the National Integrated Cancer Control Act. We just can't let COVID become a distraction, but rather a call to action to implement those important laws. And in doing so, I think we will be able to strengthen and maybe even reimagine what healthcare looks like in the Philippines for this crisis and beyond. Thank you.
Thank you very much, Cara. Yeah, that's very encouraging to hear. We really look forward in more partnerships with Russian government. Next, we also have from the pharma industry a very important company that's has been very big player in the vaccines. Please welcome the country chair and general manager of pharmaceuticals of Sanofi, Dr. Amel Maclofi Benchuk.
Thank you, Orly, and
Hi, Amel.
Hi, could you hear me?
Yes, good.
Okay, so good afternoon, everyone. Thank you for organizing this discussion, and thanks, Dindo, for inviting me to share some insights from the healthcare industry. As you know, Sanofi is a global healthcare leader, providing healthcare solutions in more than 170 countries around the world, with more than 100,000 employees, representing 142 nationalities. Sanofi has been in the Philippines for over 50 years and currently employs more than 400 Filipinos. As the previous speaker said, the COVID-19 crisis is a complex issue that requires a whole of society's approach, where governments and the private sector synergize their efforts. While the pandemic has affected more routines, at Sanofi, we are committed in ensuring that our healthcare solutions are available and accessible for the patient we serve. There are millions of patients in need of our support for diseases unrelated to COVID-19. They need just as much attention to ensure they have continuous access to our life-saving drugs and vaccines. Moreover, we in the healthcare industry are stepping up to the challenge to develop innovative diagnostics tests, vaccines, and treatments, while ensuring proper information to the lay public to fight the spread of fake news through social media. Through information, expertise, experience, and collaboration, Sanofi with other healthcare institutions is fighting COVID-19 on multiple fronts. Based on our experience with the previous pandemics, we are convinced that no single company can defeat COVID-19 alone. So we entered into partnerships for a clinical program of study if our existing medicines such as sarilumab or hydroxychloroquine could be used to treat COVID-19 patients. We support the WHO solidarity trials among other global trials and are in constant collaboration with the Coalition for Epidemic Preparedness Innovation to share our medical research. And here in the Philippines, we are collaborating with the scientific societies like PSMID, and as you may have heard from DWESH, Philippines is also part of the Solidarity clinical trial, and the first patient have been included 2 weeks ago. Recently, we announced an unprecedented collaboration to tackle this unprecedented pandemic by merging our technologies with GSK to find the vaccine as quickly and safely as possible. We are not bypassing, of course, important regulatory steps in developing a vaccine, but the pandemic is pushing the entire health ecosystem to come together as a piece and scale that are both extraordinary to drive maximum efficiency in our process. Being a research-based company, we did accumulate a lot of experience and expertise that we are sharing worldwide with the scientific community. Our collaboration with the CEPI is one illustration of this data sharing. We are currently putting most of our efforts on two projects. The first one, an adjuvant recombinant-based COVID-19 vaccine candidate, is developed in partnership with BARDA and GSK. The second one is also a collaboration using the MNRI platform of Translate Bio, a biotechnology company. And if everything goes as planned, both vaccines should be available for registration by second half of 2021. Two other steps are critical to have a COVID-19 vaccine ready to be administered. The first one is the manufacturing capacity that needs to be developed. You might have heard from the media that BMGF is engaged to address this issue. Then comes the implementations, starting by allocating the produced doses to the different countries on a fair base. Then each country will have to define its own immunization strategy. But these different steps of implementation phase won't be available without a strong private-public partnership. Therefore, we all have a role to play as we weigh the development of the COVID vaccine. It is too soon to say when the vaccine will be available for wide public use. However, as early as now, government and private stakeholders, including the pharma industry, must collaborate to get a fair amount of COVID-19 vaccine and optimize the usage of the allocated quantities. I would just add the need to collectively improve the understanding of vaccination and vaccines among the general public. The intent is to prepare our communities for when COVID-19 vaccine become available. It's only by working all together that we will make a positive and lasting change. We all need to come together in strengthening our approach. We call for a greater whole of society approach to the country healthcare, as this will prove to be crucial in the manufacturing and distribution of COVID-19 treatment and vaccine once available. Now more than ever, we should see healthcare as an investment and not simply a cost. The key to successful transition into our new normal is collaboration. The pharmaceutical industry is not a race against each other, but against COVID-19. The healthcare industry also needs the support of all sectors. Now more than ever, we need everyone to be on the side of science and to invest in the healthcare system for the benefit of the Filipinos. Investment in innovation and strong public-private partnership will be vital, not just in fighting COVID-19. This will not be the last new virus we see, but the progress we make today in innovation, process improvement, and partnership will also help us respond better to any future crisis. Thank you, Orly. Thank you very much, Orly.
Thank you very much, Dr. Amal. Next, we've been talking about technology since the start of the session. So right now, it's really time to hear from technology. Let's welcome the Country General Manager of Microsoft Philippines, Mr. Andres Ortola. Andres, welcome.
Thank you, Orly. How are you? Thanks for the invitation. Thank you, Lindo, as well. Pleasure to be here. I've been listening to all the speakers, really learning. It's been great to hear about the many initiatives. And so for us, Orly, we've been, you probably know, we've been working with the public sector in the healthcare industry in particular, all around the world, and we've been focusing on research. We've been focusing on IT and internal systems, so it makes hospitals more efficient. Also focusing on the patient experience and how can we optimize the many scenarios to be able to deliver the full digital experience. Now, COVID-19 obviously accelerated many of these things, many of these projects, and we as a company have taken fundamentally two approaches. One, which is with our corporate teams, making sure global research firms and governments have access to massive computing data and computing power and data. We have made data initiatives to share as much as possible, to share insights from one country to another to companies. So many of my former speakers talked about alliances and working together. And I think this is our contribution to that. And on the other side, we of course been working on the ground with governments on what we call the NPIs, the non-pharmaceutical interventions, which have helped in governments in the flatten phase. Hopefully now we continue helping them in the fight phase, and we see an increased usage and dependency, if you will, of digital technologies, right? And fundamentally, technologies that are ubiquitous, they can be deployed fast, and they can be reliable. That's at the core of what we've been doing with the government. So when we look at other governments have done and the way our teams have been engaging, we feel strongly that the approach of test, trace, and treat is the right one, and because we have seen this working in many places. Now, our learnings is technology has been present in all those steps, in all those scenarios. I could mention a few, and I had a slide prepared, but I will go without it now. We've been working, for example, in the testing phase to making sure the testing experience is something that it's manageable, it's scalable. People talked about trust today and people coming to be tested. That's for us is fundamental. So we want to make sure that experience of testing is a fast process and is secure. At the same time, we also need to make sure that information is being taken almost in real time or in real time back to data platforms that can make intelligence out of this information and can alert and can drive action on the other side. When you look on the tracing piece, we've been working with governments such as Korean government, for example, on contact tracing applications. And contact tracing is also a very complex environment when it comes to tracing and what to do with that information. We've been working on applications of, for example, predicting higher impact areas for COVID and allowing the government to take action before there is higher spreads. With that same information, we put at the service of other applications to make sure we inform the citizens on which commute routes are going to be safer for them according to being closer to infected points. We have managed to collaborate and create self-quarantine applications where you can report yourself and you can activate a doctor appointment. You can activate a tele session with a doctor, or even drive alerts if the person for whatever reason leaves home. We'll activate an alert so someone can take action on this. On the treat piece, there's many things that we've done in the assisted experience for doctors to have A, more scalability, B, more safety when it comes to those consultations. One of the things that we're very proud of is we recently launched something we call HealthBot. It's been available before. Basically, they're ready-made packages and chatbots that we can embed into any technology that basically will allow any hospital, any institution today for free to set up an assisted process that I log into the hospital, I get a free scanning, and if I want to speak to a doctor, just simply move my communication over to a doctor or someone that can do a different screening. There is a big integration happening right now with, for example, imaging technology. We applied artificial intelligence and are able to tell doctors in real time whether there's a higher chance for this particular case of being a COVID-19 case, and obviously higher the priority of that particular patient. There is even, for example, an experience of just around the whole experience of the patients and doctors. For example, family engagement. In some countries, we've seen that once a patient gets into isolation and with a country in lockdown, nobody knows has no way to communicate with patients. So we have enabled platforms for patients just simply communicate with their families, or families to access, excuse me, real-time information about cases on the patients. And last but not least, it's all the big question about the new normal. Our opinion is we don't see a new normal being possible without the assistance of technology. When you look at social distancing, when you look at how are we going to run or manage thermal scanning at scale, how are we going to manage cleaning protocol management, all these new scenarios assisted with technology, we have been very, very active on those fronts with solutions that have been delivered somewhere else already for our customers. But I believe fundamentally, and before I move this, just one of the things that we have seen is, or we learned in the Philippines by our collaboration with the government, we have been also working in non-healthcare related projects. Let me take two just quickly. We're very proud of Rapid Pass application, allowed people to move around, frontliners to move around freely through checkpoints. Number two, what we've done with Judiciary Department and virtual hearing courts. Those projects have been put up in record time. I'm talking about weeks time. We delivered real digital transformation, real value that is here to stay. And I think to finish early, I think we foresee a future of partnerships between public, private institutions. We foresee a future where all these companies work together to build a foundation, a stronger foundation for internal policies to allow more and more value to be delivered by the technology, to modernize the way we work, and last but not least, to introduce and keep introducing innovation into the healthcare system. Data is going to be the new resource in this new scenario. So we believe in trusted sources, reliable, and of course secure handling this information. That's all for us today. I look forward to continue the conversation and hopefully partner with many of you to continue to deliver this value to you and fight this pandemic. Thank you, Orly.
Yeah, thank you, Andres. We really hope that we can integrate all of these technologies, especially now that we're doing all of these T3 and everything. Thank you very much. And next is another technology company which I think some of you use for payment, especially online payment. Let's welcome Managing Director and Chief Operating Officer of PayMaya Philippines. Please welcome Paulo Azola.
Thank you, Orly, and good afternoon, everyone.
Hi.
Thanks for having me. It's a pleasure to be here. First of all, I'd like to say that I am from the city of Milan in Italy, and we were hit very hard, very early. So for me, this is a pandemic that really hits close to my heart. And on top of that, my father is also a doctor. So if anything, for me, it has even heightened the desire and the drive to help solve problems for Filipinos here also. Now, one of the things that really struck me from what Bill Luz was saying earlier is he really said that at a government level, but I'd even say at a corporate level, going digital is the only way that we have forward. And if there is any silver lining from what we've had, if we are going to be learning anything from this pandemic, this is a great learning opportunity for us to say, it's the time really to push certain things that in the past were not a priority. Andres earlier mentioned, and we partner with Microsoft on a few things, and so I'm glad that Andres talked about some of the things he's doing on telemedicine. It is applicable not just to COVID-19, and I'm sure that's what everyone on this call on this conference is thinking. It's applicable beyond COVID-19. So there's a lot of patients in telemedicine, for example, that will require the support of frontliners, not just for COVID-19 cases, but also for other types of diseases that are afflicting our population. Now, I have a few slides and I'll go countercurrent compared to anyone else. I thought, given that I'm the last person to speak, or one of the last people here, I thought to keep people interested, my face is not enough, so probably a few slides will get people to be a bit more interested. So I'll share my screen. Early, can you just tell me if you see my screen now? Right now? Yeah. Okay. Great.
Yeah, we see it.
Okay.
Looks
Thanks.
good.
Appreciate it. So my name is Paulo, and I'm the Chief Operating Officer of PayMaya Philippines. We are not experts in healthcare. We are a support to the healthcare system, and we've tried to give as much as possible that we can in order to support our frontliners, our country, and to make sure that that we can get out of this as soon as possible and improve from what we've seen so far. Now, just a couple of 1 minute on what we do as a company. So PayMaya mostly is famous for, at the center of the page, it's e-wallet. So we're the most recognized e-wallet in the Philippines, according to BSP's survey. But I think the portions of the company on the sides of the page, on the right-hand side, Smart Padala, which has 30,000 touch points for people to send money across the country. And on the left-hand side, our PayMaya Enterprise, which helps businesses to accept payments and to move money around, are maybe less known to be a part of what PayMaya offers. Now, I'll try and weave in what we've done over the last couple of months in order to support the situation of everyone on this call. So the challenges and the opportunities are really related to some of the key stakeholders here. So on the patient side, on the medical professional side, we've seen a flooding into hospitals of cases and of people who require healthcare, and therefore that has deprioritized a lot of people who are in need. And with digital enablement, as I mentioned earlier, telemedicine is something that really has come to the fore as a fantastic solution to help alleviate the issue. Then you have social distancing measures and a need for citizen education. And that's where teleconsultation and even education via e-learning and social media has really helped us or help the professionals in the industry to get to their patients. Now, in terms of the retail side, we've also seen a significant amount of innovation in terms of retail. So there are companies out there, including the drugstores, that have embraced digital in terms of end-to-end e-commerce, in terms of contactless payments, and in terms of other types of innovations that are helping to reduce the spread of the disease. On the social security side, we have seen social security agencies and government agencies use digital financial services and digital companies in order to transfer money from SSS, for example, to its constituents, but also from DSWD to the people who are most in need. And on the hospital side, of course, there are challenges in terms of higher costs and lessening revenues. And companies like PayMaya and others, including Microsoft, have been there to enable hospitals to be more efficient in terms of technology, but also in terms of processing payments. Now, this as a whole has, I guess, driven a larger accessibility of healthcare services. And that's the objective of companies like Microsoft and like PayMaya. We've seen in the news a lot of talk about how cashless is on the rise, how it's very difficult now to exchange currency, how physical distancing is making it very difficult for cash. And if anything, it has allowed Filipinos to really embrace cashless. And I think that's true not just of the regular Filipino, but also of people in the healthcare industry. Now, the Philippines has always been a little bit plagued by the fact that Filipinos have very limited access to financial services historically. So about 72% of the population does not have a bank account, and about 96% of people do not have a credit card. And the majority of people who are banked, of the 28% of people in the Philippines who are banked, are actually very, very banked on a limited basis. They have a cash card, they have a current account, and they can do very little with that. So e-wallets have really risen quite fast as becoming the easiest way for Filipinos to access various financial services, like sending money to each other in a time of need, like paying for goods and services, whether it's healthcare related or not, like ordering online, and like receiving financial aid from SSS and other government entities, such as the DSWD. And then there's the topic of telemedicine, which I think will really hit close to a lot of the people on today's conference. This is something that Andres mentioned. This is something that has been mentioned by other speakers today. But really, telemedicine enables the continuity of being able to provide services to patients. And one of the ways that that we really got support or supported the hospital industry and the doctors industry was a partnership that we did with Makati Medical. There are plenty more partnerships that have spawned since then, but this was the first one that we did. The trial started as early as March of this year. So in the middle of March, as soon as the pandemic was starting, we had 150 doctors who signed up to do telemedicine for Makati Medical. And 70% of those doctors are using digital payments to accept payments via Paymaya and via bank transfers to Paymaya. More than 95% of those doctors who have accepted or who have used digital payments have said that they will continue to do telemedicine and to use digital payments in the future, even after ECQ is lifted. So there is a paradigm shift in the way that doctors are working. And I think that from frontliners, they're now becoming onliners. Now, the telemedicine kind of implementation taught us that video conferencing services and payment gateways, integrating those to the electronic medical records and the experience, the medical experience of the patient, has really been a great step in the right direction. And that's, I think, the 95% of doctors who have embraced this in a positive way have, I think, are a testament. Now, in terms of Makati Med, they are also exploring to expand this, these consultations to 60%, and 60% of their consultants are saying that they want to use telemedicine going forward. And one of the major factors that have enabled adoption are the ease of use and the seamless integration to some of the technologies. Now, the hospitals and the clinical operations go beyond Makati Medical. And of course, we've had today, I think, Marikina Valley launched, and several of the other hospitals that you see on the page have also launched. In addition to telemedicine, we're supporting a lot of the hospitals across the country with contactless terminals for payments, as well as for online payments, and dashboards to be able to monitor transactions properly. So in general, I think on the hospital side, we've seen, and on the doctor side, we've seen a great embracing of digital technologies for payments and for telemedicine. But we've also seen on the retail side, on the retail pharma side, a very strong growth of cashless transactions as people buy more and more essential medicines and supplies online. And we've seen that through Mercury Drug. We've seen that even on e-commerce websites like Zalora and Lazada. And it has really driven a lot of commerce to happen online rather than people having to go in store. There's also the drive-through component of not having to go into a Mercury Drug. I once went past the drive-through of Mercury Drug on EDSA, and there was a lot of cars waiting in line there. So Mercury Drug has really embraced or started to embrace the online piece for ordering supplies and essential medicines. And in terms of lifestyle, really, with people working from home a lot more, with people being more isolated, mental health, lifestyle, mental resilience has really come to the fore. And we've, for example, partnered with a company in order to provide our employees and some of our customers even with mental health services to make sure that in these tough times, it's not just about the people getting sick. There are a lot of people out there who are suffering, and providing them with services that will help them get through this tough period is very important. So psychological counseling and coaching is also something that we've helped to provide. And then, of course, I think the donation drives, as well as the social security agencies paying out to people, is something that in partnership with government entities and in partnership with other donation drives has been extremely important in making sure that the money goes from people who have money to people who are really in need of money. So I do think that if there's any learning, again, if there's any silver lining from this crisis, is that digital adoption and digital financial inclusion is more important than ever in helping the government, in helping the people who are most in need, as well as in helping corporations to reach and to speak to their customers even more. Thank you, Orly. Appreciate it.
Thank you very much, Paolo. That's very, very informative. And I hope we can expect a lot more from PayMaya. Next, what we have is the sector that's really now at the receiving end of this crisis. Our next reactor has actually been a COVID survivor. Please welcome a non-resident, he's one of our non-resident fellows of Stratbase ADR Institute. Please welcome Dr. Vicente Vic Paqueo. Hi, Vic. Vic, are you there?
Can you hear me now?
Yeah, I can hear you.
Okay, can you kindly flash the diagram that I sent to you?
Raisa?
Yeah. Everything has been said that I wanted to say. So I will essentially ask the panelists and the other, the main speakers, 3 or 4 questions, really. But let me frame first these questions. Okay, can you flash it again? Yeah. So this is just to put the things, the questions in perspective. This is a diagram showing the channels of potential economic impact of COVID-19. Essentially, it has the direct cost of the sickness and mortality that it brings about, and that could overwhelm the health sector, costing it, etc. And another set under the heading aversion behavior. This is something that Ron talked about earlier, aversion behavior, which drives government policy, such as imposing lockdowns, testing, etc., and decisions by firms and institutions to retain people, make redeployment decisions, hiring, termination, etc. And consumer behavior is also being driven by this aversion behavior. They don't consume as much as before because they're afraid of going to the restaurants and they have less money to spend because they are out of work. So those are examples of aversion behavior, and this aversion behavior through these channels of government mandate and firm and institutional decisions and consumer choice affects various sectors, but particularly education, manufacturing, retail, services, and trade and transportation. These are affected in that they are often closed partially or totally. They have to practice costly distancing of workers, and the consumption of their outputs is also very much affected, like tourism, transportation, etc. Now, the boxes in the bottoms are physical, are of course the outcomes, which are essentially declines in wages and income because of unemployment, and as well as maybe they're employed, but they have to work only half time. They're being furloughed, no work, no pay, etc. That, of course, results in increases in poverty incidents. These people, particularly the low-income people, will have low savings, few assets, and therefore may go hungry unless they have some support from the government, and that's why the government has provided them with subsidy in kind or in cash. Of course, the question there is how long could government continue to support them without itself being in a bad public finance position. So this wage and income and poverty effects could be immediate, but there is a long-term effect, loss of human capital because of education will be affected, training, in-plant training will be affected, and then you have infrastructure deterioration. By this, we particularly refer to the business infrastructures. Many of them will have to close down, and maybe they could come back later, maybe not. So there's this question of whether we're going to have a so-called V-shaped recovery, or like a ball, you bounce it, but then it comes back immediately. Or if you believe, as a lot of businessmen are saying, it's not easy. Once you close down enterprises, it takes time and maybe never to get back on your feet. Okay, so essentially, then it is this aversion behavior plays a very important role in driving these consequences of the COVID-19 pandemic. You know, this often comes under the term confidence, consumer and business confidence. Now, what is missing here is that the what I call the impatience part. You know, when you have people run out of money, they are not able to go out for weeks and months. They become impatient. So that would call you have aversion behavior, but then you will have as a feedback loop an impatient behavior. Now, so there are two tensions that I think we need to focus on, that I'd like to focus on. The tension is essentially this: the benefit from responding to aversion behavior, like this government lockdown and other mandates. They have benefits in terms of the control of the rate of infection, spread of the infection, and the reduction in mortality and morbidity. On the other hand, the impatience essentially refers to, as I mentioned, to the fact that people acting naturally are want to go out to enjoy life, they cannot, and worst of all, they actually may be at risk of suffering from having no income. They cannot feed their children very well, so nutrition of children can actually be affected. In effect, there is also the problem there of survival. Okay, so The questions that I have are as follows. How long can people tolerate or be patient with the adverse consequences that are affecting them? How long can they bear the burden of these mandates where they are actually at risk, if not actually already suffering from the consequences of unintended, they may be, of these control policies. Now, and so the question that I have particularly for the speakers are essentially, do we have data that measures how long can this strict lockdown hold before people begin to go to the streets? And suppose that can this patients be longer than let me backtrack. These patients, and we don't know as of now whether this patients is going to be shorter than what the number of days or weeks that would flatten the curve and in effect get control of the spread of the virus. Or is it the other way around, in which this becomes so impatient and fearful that they're actually not going to tolerate anymore extension, even if the spread of the virus has not yet been flattened. And maybe because the economy has been flattened first before it could flatten the spread of the virus. So that's the second question. The third question is, suppose that happens, that before the government can flatten the curve, that the people, lots of people, huge segments of the people, particularly the poor, have run out of patience already. What do you think would happen? Will there be blood in the street? So this is a question of this so-called securitization. So that is the third question. How much time do I have? Can I my fourth question? Orly?
I think time's up.
Time's up? Okay, I stop there.
Okay, thank you, Professor Vic Paqueo. Those are very hard questions, I believe. And I believe our panelists are thinking of those answers right now. Next is, again, from the patient sector. We'd like to hear Conrad from our cancer advocacy for fighting for the cancer bill, cancer law, that is. Please welcome the convener and spokesperson of the cancer, and the president. He's actually the president of the Cancer Coalition of the Philippines. Please welcome Mr. Paul Perez. Paul? Hi, Paul. Paul, are you there? You're on mute. Hello, Paul? Is Paul there? He's probably having some technical problems. So to save time, hello, Paul, is he there? Yeah, if he's yes, Paul is there. Can you hear me, Paul? We can't hear you. Hello, Paul? Oh, you got lost. Okay, we'll just move on to the next then. We're also lucky to have a very important stakeholder here. We're glad that he's here because he represents most affected sector, and it's actually the sector of the senior citizens. Let's welcome former National President and current head of NCR Federation, Senior Citizen Association of the Philippines. Please welcome Councilor Jorge Banal.
Thank you very much.
We'll get back to you.
Thank you very much, and a pleasant afternoon to all. First and foremost, our Federation of Senior Citizens Associations of the Philippines, known as PESCAP, would like to extend its appreciation and thanks to Stratbase ADR Institute and CitizenWatch Philippines for jointly sponsoring today's forum. Also, our thanks to the speakers and reactors and the health frontliners and stakeholders for sharing their good thoughts on their assigned roles. You know, I would like to turn back the hands of time and please be reminded of what the late Quezon City Police Chief General Tomas Caringal asked former Vice President Emmanuel Pelaez. Mr. Vice President, what is happening to our country today? This must have been during the martial law days. But today is a much worse scenario as our beloved Philippines faces a global crisis, a war against the scary, deadly COVID-19 pandemic. And the World Health Organization recently declared that the coronavirus that has caused COVID-19 would become endemic, like the HIV. And this virus may never go away. Hence, WHO's warning against any attempt to predict how long the coronavirus will be alive and circulating. And at the same time, it's calling for massive effort to counteract it. Under these critical and abnormal times that we are now in, with more than 4 million infected by the virus, which led to more than 291,000 deaths worldwide, our PESCAP would like to reiterate its appeal to all concerned. Let us strictly observe government and IATF protocols and restrictions and practice self-discipline. We appeal to our national and local governments' continuing and massive support via providing strict quarantine rules like wearing the PPEs and social distancing, and ample protective and safety quarantine testing, tracing, isolation, recovery centers and areas, and inclusive recovery towards the new normal. Speaking for our senior citizens, as young ones who are free from compromised immune system and who are actively employed, like government, company, business executives, officials, and employees, need to be permitted to go outside our respective homes, but subject to quarantine rules. Finally, we would like to appeal to one and all for a ceasefire on politics. fake news, bashing, and similar negative acts. Let us all join hearts and pray to God Almighty, and with government's continuing massive support, the people's strong cooperation and self-discipline, and with God's graces and mercy, this scary and deadly COVID-19 pandemic will hopefully soon come to our full stop. This is PS to the more than 8 million senior citizens in our country. Let us be most prudent and stay healthy and safe at home. Mga kaibigan, thank you and good afternoon.
Thank you and good afternoon, Councilor George. In a few years, I'll be joining your group. Yeah. Paul's back. I heard there was a thunderstorm there and a fluctuation a little bit. I'm glad it's back. Again, he's my comrade in arms when we were advocating for the cancer law. Please welcome the president of the Cancer Coalition of the Philippines, Paul Perez. Hi, Paul.
Thank you, Early, and thank you, Dindo and Paco, for this opportunity. Allow me to introduce ourselves first. We're Cancer Coalition Philippines. We're a national coalition of cancer patient support organizations, healthcare providers, cancer advocates, and champions. And basically what we do is we engage and work with government, policymakers, private sector, civil society, international development organizations. The reason why we put together ourselves into one force is because we wanted to really inspire breakthroughs and catalyze adoption of innovations and good practices as far as cancer care and treatments concerned in the country. Well, in relation to the topic on hand, we know for a fact that in the midst of unprecedented pandemic, the government have rightly prioritized containing the virus. But there is another side of the COVID pandemic. There's another story to it, and that is the burden on non-COVID patients. Cancer patients, cardio patients, dialysis patients, and we just heard from the senior citizens group have been overlooked, and at least we feel this way. And not just them, their families, their caregivers, and are also very much affected. The obvious issue is that access to treatments were put on hold. Patients postponed their biopsies, they postponed their surgeries, and so many stories we've heard that they've also postponed their chemo treatments. Unfortunately, cancer treatment can't wait. Our key question is this: how do we minimize collateral damage to our equally important non-COVID patients? There are numerous stories that need to be told, and the reason why it has to be heard is because their issues, their concerns, their challenges should be considered as we work on this new normal. The strength and the weak points of our health system is now very much in view of everyone because of this pandemic. As such, we need to really consider all points so that when we define this new normal, we are really totally rebuilding back better, as Dean Mendoza mentioned. Right now, non-COVID patients are at loss. They don't know where to go or which treatment facility is COVID safe. And if they know which one, how will they get there is another problem, knowing too well that mass transport was not available. We in the Cancer Coalition have launched Magsikilos, which is to bring indigent patients from their homes to safe cancer centers. In our daily trips, we hear about stories of day-to-day issues, like they need to be protected. So do they have access to PPEs? One of the founding members of the CPH, and I think she's in the group right now, Kara Magsano Kalikpala, if I can serve, has been giving PPEs to cancer patients when we bring them to these hospitals. But we tend to overlook this. Also, there are a lot of kids with cancer. Do we have PPEs for children? We reached out to so many groups and started to collaborate to find short-term and long-term solutions. It's a healing collaboration, that's how we call it. But our patients still have so many questions, and I'm glad that a lot of it were kind of answered this afternoon, but still, there are key points that we need to really remember. Number one is, what is the new normal for cancer treatment? What is the continuum of care post-COVID? Now, we know for a fact that operating rooms are right beside ICUs, which are basically home to so many COVID patients. So cancer patients are really scared. They're really afraid. So will there be funds for cancer treatment, recognizing the fact that there was so much funding going for COVID and other diseases? Will there be medicines available? Will there be mass transport for patients? Practical support, which is almost always overlooked, is something we need to really take into consideration. Okay? We need to hold patients' hands and lead them the way to navigate through this new normal. Maybe patient navigation programs should now be tech-enabled, given that social distancing is a mandatory thing now. Facing cancer is difficult in itself. Let's not give them another plight. Let's not give them another fight. As we move towards GCQ and subsequently total lift of what we're doing now, we should never forget that there are other stakeholders in the health sector that needs to be considered. And the cancer sector is one of them. Maraming salamat po.
Thank you very much, Paul. Paul, thank you for joining us. Very important. Actually, I heard a while ago that cancer is a pandemic in itself with more than 80,000 deaths a year. It's really alarming. I think we'll take a couple of questions for the open forum. Paco, do we have time for that?
Yeah, go ahead, Orly. I think we have a couple.
Yeah, I encourage everybody to use the chat feature on your browser or the Q&A feature.
There were a couple of questions earlier. I can't see them now because my device restarted, but I think if you press the Q&A, you can see questions over there.
I see some questions. Okay. The first question is, the amendments to disease surveillance law has been mentioned. What are the things or elements needed to be imputed to improve the disease surveillance in the country to have an efficient system of collection, accurate and timely data that will inform our decision makers? It doesn't say who wanted to address it. Can anybody from the panel venture an answer?
Orly?
Yeah.
Yeah, Mike, Defensor.
Yeah, call Mike.
Yes. No, in passing, replied to that question earlier. I mentioned that the Public Health Emergency Act, there is a provision there that prevents, well, it allows, but it should be a court order, ordered by the court. Although there was a petition by IBP to allow this, this was, well, again, if you noticed, in our COVID listings of patients, it's patient number 1, 2, 3, 4. No, there's never a name mentioned. So I'm just on the law only. It has to be amended that when the disease is not of or there is public importance or public emergency and a need for the patients, there is no need for a court order. Number 1. Number 2, there has to be a determination, of course, by the doctors. Because, you know, the Public Health Emergency Act was in consonance with other sicknesses like AIDS, HIV. So it's a private thing to the individual, to the patient. And there's a human rights aspect involved. But in this particular case, actually, the patients really wanted for themselves to be known as positive. For example, in the case of former Secretary Rene Velasco, also professor of UP, when he was brought to the hospital, he was already unconscious. So there was no way that he could allow that his name be revealed. And then, of course, you have to go to court to do this, no? Even if there is a waiver of the patient, because, again, the privacy of the patient is given importance. So that law has to be amended. As to the other aspect mentioned there, as regards technology, as regards security soldiers being asked to do contact tracing, that's a different matter altogether. All I'm saying is just the law has to be amended.
All right. Thank you, Kong Mike. Yeah. There's another question here from Sarah Gomez Armas. Hello, this is Sarah Gomez Armas, correspondent of International News Agency, EFE. I would like to ask our panelists about the last extension of ECQ in Metro Manila. The capital will be strictly confined longer than Wuhan COVID-19 outbreak center. Does that make sense? Is there a real basis regarding the current health situation? It says figures are stabilizing for that precaution measure. How long could that be sustainable? Anybody wanna from the panel? So he's asking about basis and sustainability of the extended ECQ.
Well, already I see Councilor George Banal here of Quezon City, but just a quick reply to that. I think, to be honest about it, the testing now is only about 0.8% of the total population. So if you're asking about the data or the basis, there really is no such basis. It's a question between the question between the health and the economic side of the issue. People are already saying we cannot anymore allow the situation to continue because of economic reasons. But there are also people, and I think I can speak for the doctors in charge of COVID of the different hospitals because I am in touch with them, that they are afraid of the second wave of COVID that will affect us because of the opening. So basically, whether we open or not, whether we allow the which sector, which industry to work or to function is a question again of testing. All the speakers that I've heard are all saying, you know, there's fear here, there is anxiety in going to work, so on and so forth, both on the economic and health side. So, and I think more or less there's a consensus that testing is very critical for all our decisions, both on the economy and on the question of health.
Oh, thank you again. I see some questions and most of them have been answered. I'm open to one question that was looking at this Q&A. Most of them have been answered. Are there any more questions that you would like? Yes?
Orly?
Yeah, Vic?
Yeah.
Is that Vic?
I think that the thing of sustainability is exactly the question that I posed.
Correct.
And I'm afraid that we really need to find imaginative solutions because a lot of firms are not in a position to go further. A lot of them are about to close. They have laid off, some of them 30% of their workforce, some 40, some 20, and this is not a scare tactic. I've seen the numbers from a survey of firms. And so unless government is really able to kind of and has the money to support, you know, sort of spend billions and billions more, or are willing to borrow money from let's say the international financial institutions, then I don't see that it's going. I mean, it will be limited. The number of months that you can sustain this level of control. Now, having said that, there are proposals, but basically that would allow firms to continue to operate more months, you know, by kind of through rotation of workers, through reducing the benefits of workers, so that in effect they can, instead of laying off two workers, they will have one position being filled out by two workers in two shifts. So, but you know, the question there that I think will have to be addressed is to give them guidance as to what's their scope of flexibility to make this kind of adjustments before they run afoul of regulations and the laws in the Philippines, labor laws and regulations, because they are very strict and tight. You know, there is such inflexibility in our labor regulations and laws.
Okay, thank you very much, Vic. I believe I'm being signaled that they're way over time. Thank you very much. It's really a very complex discussion, and right now, before we turn over, I turn you over back to Paco, I'd like to remind all of our panelists to please stay on and please switch on your videos, your cameras, so that we can take a nice picture of all the panelists and stakeholders who have spoken this afternoon. Paco, take it away.
Okay, thanks, Early. I think the best person to close this really is Mr. Dito Manhit, unless he wants to leave this privilege up to me.
I just wanted to thank everyone. We wanted, when we were talking about this in the Institute, to get everyone to speak. When you say everyone, the stakeholders, we're all part of this challenge, and quite thankful for all our speakers, reactors that truly represented all sectors in Philippine society, not only government, but private sector. And in the private sector, not only the hospital or healthcare, but even the pharmaceuticals, even technology. It's a great way to spend an afternoon. I think we have over spoken in terms of time, where it's nearly 5:30, nearly 4 hours. But I think that's the whole idea of this kind of virtual RTD in our institute. We want to bring people together, and hopefully to get our decision makers in government to listen to us and maybe learn from all our views and the knowledge that we have all had gathered here this afternoon. So thank you again to everyone.
Okay.
So, bye. Thank you.
Thank you.
Thank you. Great, Paco. Maybe we can tell everybody that we've recorded this whole proceedings if you want a copy. And actually, I saw that the Q&A feature has a lot of questions and answers, and we can post them for those who, or send them for those who are interested, especially our friends in media. And now I think it's photo op time.
Yes. So let's count down together. 1, 2, 3, smile. All right. I'm guessing that one of our team members was able to take that photo. Thank you.
Is that all?
Thank you, everybody. Yeah.
Did you get everybody?
Well, we have a recording, so we can just screen cap. We can just take a screenshot of everybody smiling. That's what I think is going to happen.
Okay.
Yeah.
So we're good. Okay.
All right.
Thank you, everyone.
Thanks. Goodbye.
Thank you.
Bye.
Bye.